You're good beyond the tag?
Oh yeah, I'm Gucci.
Okay, perfect. I think we're going to start then. Let me just rearrange the webcam real quick.
Okay, there we go. I think people on my
The
screen
left
should
on
be
the
able to hear
left, the
me,
right on the
and
right.
everyone else shouldn't
Me in
because
the
that's
center
being weird.
as the perfect centrist. And
Check 1 2.
let's go. So welcome everyone. Yeah. We're going to start by introducing everyone. Let's start by sourcing support. Thank you for joining us. I know you don't like panel usually. Yeah, so introduce yourself. What do you do? Where do you stream?
Hey, I'm sourcing support, stream politics, and programming. Right now, it's probably about a 50-50 split, but just depends on my mood in any given week. Yeah, that's about it.
All right. Yeah, thank you for joining us. Post Norman, first time seeing you. How are you doing? And yeah, introduce yourself.
Hey, I'm good, thanks. Yeah, thank you very much for having me on. I'm post-normal. I'm a grad student in, functional neurosurgery, like neuroscience stuff, but I like talking about neuroethics and effective altruism and the future and doing a bit of politics here and there. Been kind of branching out into it recently. And yeah, I'm streaming on Twitch under post-normal.
Nice, awesome. Senpai Chow.
Hey everyone, I'm Senpai Chow. I stream politics and Maple Story. I just recently graduated with a degree in political science and international relations. You're going to be seeing me on a bunch of panels, a bunch of podcasts, and for the first time ever, my first Twitch politics debate. I've been doing this for a while, debating for several years, but it's always going to be nervous. I'm a little bit nervous right now. Thank you for having me on, Mr. Geek. Always a pleasure.
You're welcome. Soon I'm gonna have to host a panel. What is worse, playing League or playing Maple Story? I really invite you.
Looking forward to it.
Trick Switch.
Hey, I'm subbing in for CityCat. I stream gaming and politics and witchy art stuff. I study design, so nothing to do with politics or law, but I'm gonna try my best.
Awesome, and thank you for joining last moment. You really saved my bacon on this one. So yeah, thank you so much. Now for the right, let's start with someone who's coming back for the second time. Red, Gray, Blue. Thank you so much for joining us. How are you doing? And yeah, present yourself.
I'm good, bud. Thanks for it. I appreciate it, and thanks for having me back. I guess in summary, really what I am about is hopefully creating an environment where positive discourse around politics is something that would help. I guess really create a place where people can accept different political views and at the same time put forward ideas that we can actually implement in society, because I believe a lot of government policy tends to be around compromise, and right now we're in an environment where political ideology is like the driving force in whatever we do, and unfortunately it creates an environment where people are really hateful towards each other. So I'm looking forward to a good conversation, and generally I stream politics. I would say I'm probably center right, not necessarily a full-on conservative, so you guys might be like, yo, is this guy really on the right when you hear some of my viewpoints today? But anyway, that's my thought process and what I do. So I'm looking forward to it. Thanks for having me on.
Yeah. Now let's switch to the loneliest ANCAP in Canada. How are you doing? Last username.
I'm swell. As Mr. Geek points out, I am a libertarian anarcho-capitalist, one of the few in Canada. I stream here on Twitch, talking about politics and philosophy, do a lot of reading, and a lot of these sort of panels. So I am happy to be here and looking forward to a good talk with you guys.
Yeah. Thank you for joining us. And yeah, now Brent O'Bucks.
Hey guys, I know a lot of you on Twitch, or I've seen a lot of you guys. I haven't been streaming much, but I still come on panels when I can or when they're available. And thanks for asking me to come on, Mr. Tugeek. And so I'm more right-leaning, and but I try and be as fair as possible and everything in all positions. And yeah, thanks for having me on. It's 96 degrees in Seattle, so I'm sweating like crazy. So I'm gonna do my best.
Yeah, same. It's so freaking hot here, and thank you for joining us. Beyond the tags, did you solve your webcam problem?
It was on. I don't know what happened. I'm trying to troubleshoot it. I'm Beyond the Tags. I do little streaming on Twitch here and there. I kind of dabble in politics a little bit, but mostly gun politics and stuff like that that has to do with our veterans. I'm kind of starting a nonprofit to help veterans and stuff like that. So that's my main goal. But I do dabble in politics, especially just current events, and I like to hear other people's viewpoints and stuff like that, and just kind of, I believe that we should all come to at least an understanding of each other, and then we can move forward. I believe personally. So yeah.
Yeah. I tuned in to your stream yesterday. I saw basically. I heard you talk about the work you were doing for the vets and everything. I think that's super cool. So yeah, kudos to you, and thank you for joining us. All right. So now you know everyone. Let's go. With the rules. So you're gonna have like a short intro statement, basically, for each topics. After that, you can engage freeform. You can engage freely with everyone. And at the end of an hour, because it's going to be something like an hour per topic, unless we run out of things to say, you're gonna have a closing statement. The last time you can address the previous topic is in the introduction to the next topic. Don't interrupt people during their opening and closing statement. And beside that, yeah, don't go for the eyes or anything illegal in MMA. Yeah, so let's start. Let's start right now with the first topic. Should mask be mandatory? We're going to open with red, gray, blue.
Sorry about that. I was responding to his chat. I apologize.
No worries.
So I guess really what it comes down to for me is that when we're thinking about some of these issues like around the mask, like to me it seems pretty straightforward. And I kind of commented on this briefly before in the last panel, that I believe that the best way forward for I guess regulating it is through state management of a local health crisis or a public health crisis. And when I look back at some of the policy that's been implemented in the past, there's plenty of case law and precedent as established by the Supreme Court indicating that states have the right to mandate that masks be worn. So for me, masks being mandatory are a decision of the state, and I would support them fully in the instance that they would need that. So for me personally, I am okay with masks being mandatory because I believe it's imbued in the laws as given by the Supreme Court and the Constitution.
Did you say something?
Sorry, I'm muted. Sourcing support.
So my position actually might be somewhat similar. I'm not in favor of a individual mandate that people wear a mask at all times when they're outside of their individual dwellings. However, I do think that it's appropriate for states and the federal government, where applicable, to mandate that people wear masks within businesses and government institutions. We can get into the details on that, I suppose, but that's my overarching position. And my reasoning behind that is that I don't like the idea of or the implications that come from an individual mandate of people to have a certain behavior when they're out in public.
All right. Brent Box.
No, I don't think that the state should mandate masks. I don't actually, or state or the federal government. I don't even think that's necessarily enforceable. I think that would kind of bring like society screeching to a halt. I don't know legally whether or not the federal government actually has, through some kind of means or definition, the ability to write that into law. I don't believe that they do, but I'm not an expert, so that would be good to talk about today. But no, I think that would be a mess. Certainly, people can enforce it in their businesses, and you can enforce it in maybe like state houses and things. But the idea that people are not allowed to be outside or outside of their own home without masks, I think that would be completely unenforceable. I think it would be a huge mess. And then we could get into kind of like the social problems around that and how it would affect people and whether or not how you would even meet those kind of standards. So go ahead.
All right. Trick switch.
I think that masks should fully be enforced by the government, no matter your state or country. If there is like one case of corona, I think it's worth covering all your bases and going into full lockdown and wearing full masks. I also think that on the similar note, businesses should have the ability to turn away customers without masks. And I don't think you should wear masks because it's like, oh, the government's telling us to. I think it's just common human decency to not want to continue the plague.
All right. Real quick before, please, people, chill in chat. Like, I don't know. If you don't like each other, that's fine. Don't address. Like, block yourselves and everything. Chill. Like, that being said, let's use a name.
Okay, so there are many situations. There are many ways in which we're expected to protect other people from, dangers that we might pose to them, like hygienically, right? We're expected to wear clothes, right? No, I don't know a lot of libertarians who complain that it's unethical. They're expected to wear pants, or that they're expected not to, sneeze on people. These are things that we do to not get each other sick, among other reasons. And wearing a mask is now becoming one of those things, seeing as it's, we live in a new age with a new kind of disease where we have to wear masks to reasonably protect each other. So I have nothing in principle against a social norm around wearing masks or social distancing and various other things to protect each other, or to ensure that we don't get other people sick. That's our responsibility, right? You have a responsibility to not get other people sick. I don't think there should be a legal mandate for that. Of course, I don't think there should even be a government at all. But even if there is, I don't think they should legally mandate masks. However, I have no problem with people making mandatory mask rules on their own private property or in spaces that they control. But I think you should leave that up to the individual owners of the property, so that the social norm can establish itself organically. I don't think the government should step in and mandate that. Hope that's a clear position.
All right. Post normal.
Yeah, so I think Brento Box was saying that it's going to be very difficult to enforce mask laws if we're talking about mandating it to, society as a whole. I think we can probably all agree that it's okay for a business owner to say you should wear a mask within this property that I own, or at least most of us will agree that. So the kind of crux of the debate is probably going to be over whether it's okay for the government, whether that's state or local or federal, to use the power of the law, the power of like state violence, to ensure that people wear a covering over their face. I think we should be quite careful when talking about implementing new laws. I might be on the left here, but I come from a somewhat libertarian background, and I think that anytime we want to, send in people with guns to enforce legislation, that's something we should take very seriously. Cases of Eric Garner and George Floyd demonstrate that having trivial laws that we nevertheless enforce with violence is probably not a good thing. However, in the case of masks, the benefit offered by just a simple face covering, even a kind of improvised one, is absolutely massive. We can get into this a bit later, but I have a wealth of evidence here demonstrating that there is a strong causative link between rates of mask wearing and decreases in COVID transmission. Given that the US is currently suffering, however many deaths a day, more than 1,000 deaths a day, I think particularly in places like the US where you've got a high burden of disease, there's a very, very strong case for using police power to ensure that people wear masks, at least indoors.
All right. And beyond the tags, who managed to get his scam working?
I did nothing different, and it just started working. I don't know.
Awesome.
So I don't think there should be any laws to restrict someone's access to what they want to wear or anything like that. I mean, we can go into the whole HIPAA part of it. That's a whole nother part of it, and having to, prove people with disabilities. I don't even mess with that part, but I believe that I mean, yes, a company can enforce it and stuff like that all they want, and it's just like, some places they enforce things that other places don't enforce. That's their company. They should be able to have the right to do it, and if they feel like they're doing their part, that's great. But I mean, why aren't we wearing masks daily for the flu or other things like that when the mortality rate is much higher? Yes, that someone was mentioned about how to, protecting the herd and stuff like that. But, I think that, yes, we could take, like I work and I wear a mask at work because that's what my company requires me to do. Am I worried about it? Not really, because I'm not really exactly in that affected area. But when I go out in big crowds, I take it upon myself to wear a mask just in case. But if I go out to, a place that's already regulating it pretty decently, I'm not really too worried about it. And I think that, we shouldn't have laws, at least. I mean, it shouldn't be here's a ticket and here's this, because like I said, we have other things that, the flu, does have a mortality rate, and, we're not doing that. So I don't know. I just don't know why COVID is much different than everything else out there, and they regulate a lot of different things. And honestly, I just think it should be a personal interest to wash your hands and keep your hygiene and your personal self to yourself. But that's just me.
Okay. Before I let you engage, Freddy, I just want to
Boy,
say
I don't think I got an opening statement.
Who?
Me.
Oh, so
Senpai,
I'm
go.
so fucking
Yeah,
sorry.
he was skipped, I believe.
Okay, I'm leaving. Senpai, go ahead.
All right. My short answer is yes. I do believe in mandatory mandates for masks, and the reason why is because the science is, at least the current science, is very clear in that the number one way that coronavirus, COVID-19 or SARS-CoV-2 is transmitted is through droplets coming from the mouth whenever people sneezing or whenever people are coughing. And the science also shows us that wearing a mask greatly reduces the risk of transmitting that to other people. And knowing that having COVID-19 you could actually be oh no, mind rotting. Uh, you could not show any symptoms. You could be asymptomatic and not show any symptoms and still be able to transmit it. So none of us will know for sure if we're able to have it or not. Even if you're able to get a test, that test, a lot of tests come out faulty. There are a lot of false negatives. There are also a lot of false positives. We're going into a society in which we're very unsure about who we're going to be infected, who isn't infected, and what is actually going to be happening. How's this going to affect the economy? How's this going to affect people? How's this going to affect community? And on the government side, if I believe in government, and if I know that it is in the government's best interest to protect its people and its citizens, then it has an incentive to do what is necessary and proper by the Constitution in order to take a national measure in order to deal with a national security risk, which is coronavirus.
Okay. I'm sorry, I forgot you. So before we engage Freddy, I just want to say last time I fought with the bee. This time I plan to fight with the bear. Tune in to see that. Anyway, you can engage now. Sorry.
Okay, can I start with my first question, mostly directed towards the individuals that believe that we should not be regulated on this? Is this more of a question of like there is no precedent for this, or is that is just a personal belief? Because like there's plenty of case law that's shows that there is a precedent for the state to be concerned and prioritize the public health over the individual's rights. And I specifically reference Jacobson versus Massachusetts, where they literally vaccinated people against their will for the smallpox. Now, obviously, a much more deadly disease, but the priority there is being focused on the public health supersedes the rights of the individual when it comes to your concern about an individual liberty. So is it more of a question around principle, or is it more a question around there is no established law for this?
I mean, I'm sure there's lots of precedent for the state stepping in and imposing, infringing on personal liberties for safety. That's not what for me, it's about principle.
I don't think that the government should be able to step in and start regulating it, just because they can. I don't think that's a right. I mean,
just because hundreds of thousands of people are dying.
I mean, even with the rates and stuff like that, I mean, being told, I mean, that's what they're trying to also do with guns too, trying to ban people from even having that right. And what happens when they do this, they regulate this, they regulate that, and then all of a sudden, we have very little left.
I don't think guns are a particularly good comparison here. I mean,
probably not. But...
Yeah, because like gun ownership is a conscious decision you make, whereas I don't think many people are going around going, I'm going to become a coronavirus owner and spreading that. Like it's, I think there are some good reasons for restricting certain gun ownership, although by British standards I'm pretty, let's say, fair on firearms. But firearm deaths in the US are pretty small compared to the ongoing coronavirus deaths. And then when we start taking into account the long-term side effects, which are currently very poorly understood but seem to be potentially quite concerning in terms of pulmonary function, in terms of neurological function, it's not just 150, 170,000 deaths, however much it's up to. It's also a lot of people having very long-term harms. So I think if there's a case to have government intervention for anything, it's large-scale coordination problems like this, where we are hamstrung by the fact that though it would be nice to convince everyone to behave rationally and wear a mask, a lot of people aren't going to do that unless they are coerced into doing so.
How is this a large-scale coordination problem, though?
Well, because it needs a certain percentage of people to be wearing masks in order for the R0 to meaningfully go down. Obviously, mask wearing isn't the only intervention. There's lots of things we need to be doing public health-wise. But I think that there's a massive network effect problem here in that we need a lot of people all coordinating together, and currently the only way to do that, it seems, given the last several months of the US completely fucking up the response, not to say the UK hasn't been bad and many other countries haven't been bad, but it seems that just saying let's wash our hands, let's wear a mask, let's be sensible here isn't enough to actually get people to change their behavior.
Can I ask, what is the line that you would that others would feel like the government should step in, and at what point do you feel like it is no longer the priority of the, I guess, when do we say that we endorse this kind of behavior? I'm just curious.
Is that kind of an open question, or to me specifically?
Yeah, open to anyone.
I would say somewhere around the point at which many deaths are occurring that would be easily preventable via government. I don't think government should be involved with everything, but this seems like a pretty clear-cut case, given that mask wearing is pretty minimal intervention. It's not that onerous. I would say it's less intrusive than wearing pants, and I'm tolerating laws that force me to wear pants.
How dare you?
I have a point of clarification. Sorry for Beyond the Tags. You mentioned that influenza being more deadly than COVID. And I'm wondering if it was shown that COVID was significantly higher death rate than influenza, would that change your position, or is your position more rooted in the principle of government intervention?
I'm just going off of what we have so far. I mean, per year, the flu has killed more than COVID currently. And, of course, it hasn't been a full year and stuff like that. But what I'm saying is, people die from the flu. I mean, should we be forced to wear masks? Because
maybe
there's a possibility someone could die from the flu. I mean,
so how many people typically die in a flu season?
I really don't look at those numbers. I just know that they're
up
there.
there.
I know that. Oh yeah, I mean.
So the coronavirus death rate is almost 50 times higher than the usual flu in this time of year.
Yep.
So I feel like immediately anyone who's making the argument oh, but the flu is just as bad as corona, No, I'll put that link in chat as well, just 'cause
Also,
if anyone else wants to read it.
we put massive amount of resources into combating the flu. We spend billions every year developing new vaccines. In the case of the flu, mask wearing might not help as much, although if we want to move to, a society like Japan or South Korea where mask wearing is the norm, I certainly wouldn't object to that, because the flu does have a very large disease burden. But we're talking about around 12 to 60,000 deaths per year with influenza, seasonal influenza, as opposed to hundreds of thousands potentially with coronavirus.
Well, I was just going off of the fact that someone said that because it can help the herding and preventing the coronavirus. And as I'm saying about the flu too, is like, you know, should we be forced and, fined if, you're riding your bike in your neighborhood, and you're not wearing a mask just because you might have a slight interaction with someone and you can give them coronavirus? Is the government going to arrest you for that, give you a ticket? Like, what are we talking about here? Because businesses, I believe that if they feel like they have a large crowd of people and they can help minimize the spread, because I think we could all agree that we don't want any of our friends or loved ones to get this, and we want to try to avoid it in any way. And obviously, we have to still research it to find out how to get a vaccine for it. Sure. But I mean, there's a lot of things that, I'm just saying that when you look at other numbers that are out there, have we ever worn masks for a flu season that has spiked up? Because I mean,
1918.
Well, I'm talking about us, not
No,
maybe
the
back in
US,
the day, but
the
Yeah, the
US
US did that.
widely wore masks in the 1918 flu season, and it was mandated in several areas.
well, yeah, and during an
Several
outbreak,
areas.
and we've done that, but we've done that mandated part out here, and to help fight, fight the curve. But I mean, how long have we been in this now? I mean,
But just because
I-
we didn't wear masks in the past doesn't mean that we shouldn't have not worn masks. Like, I remember in about, I think it was 2017, in one state in Australia, the flu got so bad, and everyone was like, yeah, but it always gets bad this time of year, because we didn't truly realize just how bad it was compared to previous years. And in that moment, looking back now, we're like, we should have worn masks. We would have prevented so many deaths. But at the time, we just didn't see that as a possibility. So I feel like if you're making the point of, well, in the past, for other things we didn't wear masks, maybe we should have, and maybe now's the time to normalize it.
Also, it's worth noting
The other
that
issue
the flu
with
isn't
is
just a single disease. It's various different strains. Some flu strains are relatively mild and have a low death rate. Some, like the 1918 one, have a very, very high death rate. So we should probably respond to those in different ways. And some of them, I think, as Trick says, it's probably reasonable to mandate masks to control the flu.
my whole point though is, but mandatory, making people do this because of the possibility. That's I guess that's the discussion where I'm coming from is, because we see deaths in the flu now. Now numbers, okay, maybe it's not as high, maybe it's much higher with COVID. I would have to relook at those numbers. It's been a while. But mandatory, making you go outside and wearing a mask when you may have zero to no interaction with somebody. But how do you regulate that? Are there going to be cops on every corner making sure everyone's wearing a mask? Is it going to be selective? Are we going to, how are we going to even make it mandatory, and who's going to start
there's a
issuing
lot of
tickets?
wait,
Especially on the
wait.
fact that we want to defund the police on top of everything. So
Wait,
who's
okay.
gonna
That's
write the
kind of a
tickets?
different debate.
Beyond the tags, they're opening a whole can of worms here. So, like, it sounds like you have already been convinced that it would be a good idea to hand out or to establish mandatory masks because it is able to deter or reduce the chance of transmission between people in the society. Is this why, like, you're bringing up the issues of, like, are we going to even do this in the first place?
What do you mean? I'm sorry. What do you mean?
Like, I don't know if you've been convinced yet by the arguments being presented to you in this debate so far.
I
Because
believe that I'm not going to be told what I'm going to put on my face, because I live in a place that we really don't have COVID. I think we had a total amount of cases. I think we had like 11 deaths total. My city had as very little cases, and I'm going to have to wear a mask everywhere I go because a city can't control it because people are throwing pool parties, or like what are we talking about?
Yeah, so like as I said before, is that even if you don't feel any symptoms, you could still have COVID, and even if you, the CDC even recently published something last Friday in which even if you recovered from COVID, you're still able to transmit it to other people for up to 3 months. You're still infectious. So like there are so many unknowns that we can't simply just say that like okay, well
And
since you haven't had interactions, since you haven't had since you've tested this or that, etc., you don't know if you actually have COVID. So then the foolproof way in order to combat this is to then establish universal mask mandates.
Okay, so
real quick,
what's the case
Uh,
for?
Can I ask a question? Because my hand's been up, and I'm gonna power through
Yeah,
it.
yeah, yeah.
yeah,
So, like, practically speaking on this, right? Like, beyond the tags, I understand where you're coming from in the notion that, if you're in a city that has had no cases, and then I think that there probably should not be a mandatory requirement if there is in this situation, right? But this is kind of why I point to the deferral towards states' rights, right? Because at the end of the day, if the state feels like that they don't have the need for the mask, then they don't have the need for the mask. I'm not determining that politics, but I think that when it comes to the question of whether or not we say that if the state says it, then I think that there's plenty of argument for it, because like you said there, you're dedicated to curbing the disease and making it and stop the spread. So I don't think the question is, are we dedicated to universal mandates of masks? I mean, because that's not how the topic was framed at the beginning, but whether or not that if we say that the masks are mandatory, I don't see a place where, we can't just suddenly say, oh, well, just because there's not a police officer on every corner, I don't have to regulate this law. I mean, we have laws that say we don't speed, right? And the cops are not on every corner for that, right? So like, to me, it doesn't honestly seem like you're against it. It just seems like you're focused on the rights that you have as an individual not being infringed upon unless there is a obvious need. Am I wrong?
No, that's pretty close. I mean, and like I said, I mean, with that whole, the liberty part too. I mean, I think we can all, wash our hands. I don't know why that was even brought up. Just everyone should have, but and I think that certain places need to, have different regulations than other places. And I was at the approach that we're talking about an overall mandate just across, like, in general, like it should be a law, and if you're not, you're fine. That's what my understanding was. But
Well,
I mean, if you're going to go down to state, individual state mandates, why not just keep going and go to individual like property owner mandates? Why not let each person who runs a business or something decide what the mask policy is for their business?
I agree. Like my company just enforced a dress code policy, and the dress code policy is masks for right now. And that's their company. They have every right to make any rule they want, and I'm gonna abide by it because I want to shop there, or well, I work there, so I mean, kind of have to. But
I mean,
do we think
the whole reason why we're even having this debate in the first place is because we are in many places, and I know in the United States, I don't know about everywhere else in the world, is that we are leaving it up to individual companies, or we are leaving it up to individual people to wear masks. And that's the issue, is that you're leaving way too many opportunities for people to not wear masks. And this is kind of showing how in the United States, we have the highest number of cases in the world in any country, and cases continue to rise.
Not
Deaths
strictly,
continue to
but
rise.
Why do you say there's too many opportunities to not wear masks? I mean,
Yeah, so then
Real
like
quick,
when you leave,
real quick,
so
real
like
quick, real quick. Sorry, I want to throw it. Like you can respond, Senpai. After that, I want to throw it to Post Normal, Brento, and Sourcing.
okay.
You can respond, Senpai. Sorry.
okay, yeah, so to like last username, you said something along the lines of why not just leave it to private property owners, and this could include like people's houses or businesses, etc. So like the issue with that is that there are way too many of them, that there are bound to be a number of them who don't abide by those rules, even if you present them the science and the research that shows that wearing masks is a really effective way to combat coronavirus transmissions. And when you leave those gaps, those opportunities for people not to wear masks, you're increasing risk and increasing the likelihood that more people are going to be getting coronavirus, leading to more deaths.
well, I mean, the states could be bound to. I'm sure some states are bound to not follow the rules either, to make bad laws. Why do you think the states are going to do this better than the individual property owners.
Well, yeah, so that's the thing, is that when you leave it up to the government, when there are government mandates, that mandate is then subject to everybody who is living within that sovereign boundary. So then for the state of New York, everybody in New York has to follow that rule, or else you're getting fined, or else you're getting reported, et cetera, et cetera. There is actually some teeth to it, to enforcement. When you leave it up to private property individuals, one, they have a harder time enforcing it. Two, as I said before, you're still leaving.
But they're going to be
leaving
enforcing it anyway,
gaps.
realistically. Like, realistically, this is going to be enforced through business owners saying, you know, kicking people out if they don't have a mask on. Like, the cops are not going to go around busting people without masks.
Correct. And then you're leaving public places such as parks in which they are not private property, and there's no business owner overseeing those places. Most places are actually government. Streets, parks, people where areas where people socialize,
Well, if the
etc.
government is the property owner, then I guess by my own philosophy, the government should be deciding the policy for those public property spaces. But
This is my last point, because I feel like I'm hijacking. Then I could make the argument that the entire property of the United States belongs to the United States through eminent domain.
That's a pretty big argument.
No, it's not a big argument. It is the argument.
Yeah, that's a
how it works.
huge bombshell.
I don't think that's what eminent domain does.
No,
it's not.
All right. Before we continue, real quick. All right. So TrickSwitch was replacing. TrickSwitch was replacing CityCat because she had to do something in real life. I know people have real life for some reason. So yeah, thank you so much for joining us, TrickSwitch. Shout yourself out.
Oh, I feel like I just did the intro. Yeah, I didn't really contribute much, but that's all right. Kat's very good at this. I do gaming, politics, witchy stuff, arts and crafts, and we just have a good time. Follow me if you feel like it, I guess. Thanks for inviting me on.
Good to see you,
thank
Trix.
you for joining.
Thanks, Trix.
Oh.
And there you go. And now I want to throw it real quick to Postnormal and then Brento.
I wanted to kind of come back on what Beyond the Tags was saying earlier, because I think though we disagree on some of the, exactly where the enforcement should be, I think he does raise a reasonable point in that the devil is often in the details in these things, and the main benefit of masks is wearing them indoors. So to some degree, we do need business owners to cooperate. It's no good having a state level law if you can go into any convenience store and the owner goes, it's fine, don't worry about the mask, because we can't have cops on every corner. So I think it's correct that mandation of masks via the state or government generally isn't a cure-all, and I also think that they should probably be implemented in a reasonable manner, in that areas that don't have any COVID whatsoever, okay, probably not worth mandating people wear the mask all the time. People in their car alone or out in the street where transmission is much less likely than indoors, okay, probably not worth having the police go around slamming people into the ground or issuing tickets or whatever to get them to cover up. But we should focus the interventions, and if necessary, and I think in this case it is necessary, the state enforcement on high-risk areas, and that includes things like concerts. I think there's a reasonable justification going away from just masks. I think there's a reasonable justification for not allowing any concerts or similar big indoor gatherings, and we need to kind of target these interventions so that they have the maximum impact while having the minimum burden on people. Because while us on the left here are kind of going, let's make sure everyone wears a mask, it is a burden. There's no denying that, and we should try to implement it in a way that people are actually going to follow, as opposed to just trying to do blanket masks all the time and pissing people off too much.
Before I throw it to Brento Box, I just want to say welcome to the City Cat. If you want to introduce yourself.
Yeah, my name is Kat. I'm Australian. I'm pretty much just Treks. I had a bit of a mishap this morning, but I'm okay and I'm feeling better now. Thanks for all the nice messages for everyone who's worried about me, but I'm feeling good now. And I love this topic. And my opinion on this topic is that I think mandatory masks are a good thing, especially in areas that are rampant with COVID in the US right now.
All right. Brento and then Sourcing.
Sure. I just think I think the idea of mandatory masks outside the home, like just blanket, I think that's just a little bit. Well, I think it's untenable. I don't think you can actually truly enforce that. I think if you got down to it, like it would raise a lot of questions. Like, well, outside of like what the fine would be, um, you know, how would you enforce it? Let's say on like people in society that just didn't have means to it. Like, I mean, how would you enforce it on, for homeless people and things like that? You could give them masks, right? But what if they didn't wear them? I mean, and that's starting at like some of the maybe lowest rung in society that's not able to, meet these kind of things. And if you were just if you created laws like that, how would it affect them? And then you can go all the way up. And I just think it seems like I think it would create a lot of problems and a lot of unequal enforcement. And that's aside from the fact that then it opens up a gate for that is technically already there. But how far can the government go to enforce or to force you to do things for the public good, such as wearing masks? And the idea of wearing pants obviously is one that was, yeah, okay, that's out there. You have to wear pants. So we recognize it exists. I'm just extremely hesitant to support basically any blanket federal, state, or just basically government initiatives to force people and thereby punish them if they don't do these kinds of things. I think that we have like better means. I think we have better social means. Even if we're not doing a great job right now, I still think it's probably because people didn't take COVID seriously enough, and maybe even now still aren't taking it seriously enough. But I don't think that I think that it's a huge overstep.
But if we don't do something more than relying on social means, or if America doesn't do more than relying on social means, we'll continue to have many hundreds of people dying every day. Like, I don't want to underplay the impact of these kind of controls, but that's a pretty big price for not adding a pretty minor law.
Sure,
it could be a temporary one, right? Like, I fully am skeptical, right? This is where at least I think I pretend that I'm conservative, where I believe in small government, I believe in the limitations put forward, but practically speaking, like if we're not going to I'm open to the suggestions, right? Like, but it seems to me that any step that we take that would be in the effort of protecting public good will infringe at some point on some level of individual liberties, right? So individual liberties will come at a price for a certain period of time, and this is something that has far-reaching experiences in the United States. So we've had this throughout so many different parts of our life, like World War II, Spanish flu, all the quarantines before that you can imagine that are associated with smallpox, any bad disease that you can name of in the colonial times. Like, quarantines are a normal thing in that time period. So I'm just kind of like, where do we draw the line? And if masks are too much of a mandate, let's just put a time limit on it, right? And we can renew it as necessary. So I just don't like, it's like saying, well, we can't enforce it every single time. Well, I mean, we don't enforce a lot of things every single time, but does that mean we don't say that, hey, as a good for society, let's take it seriously. Let's try to address this problem. I just feel like there's, like the questioning and skepticism of the individual liberties is healthy. And I think it's responsible, but like, then what are we going to do? Like, literally, is it just inaction? We just say, oh, we'll never take government action at that point, or literally any oppositions are fine. It's just, what do you want us to do?
I mean, can someone substantiate the claim that the government specifically needs to do it, or it won't get done? I don't see any particular reason to think that this needs to be a government mandate versus a mandate from business owners and people who own.
Because right now you see it in society that there are plenty of people not wearing masks, and the spread is still significant, and there is no government mandate in many of these places. I feel like this is just
to turn that around, last year's name. do you think that the government implementing a mask law of some sort would have no effect on people's rate of mask using?
It might. I don't know. Like I haven't really. I mean, I haven't seen. I don't see particularly why it would. Why it would have a significant effect. Like, I mean, I can only speak
Really?
like
Do you
around
think people
here.
don't
Maybe
respond to
Canadians are
incentives?
so polite, but like almost everyone here is wearing a mask, and people are definitely always wearing a mask in businesses, and businesses are always pretty diligent about making sure that people wear masks. And they were doing that before it was legally required to wear a mask. So I
There
don't
was a
see.
report recently by Goldman Sachs that estimated, obviously for their kind of internal investor base, but estimated that the marginal impact of a mandate would save about 5% of the GDP in the US.
How?
Well, they make assumptions about the amount it would reduce COVID transmission based on
And
various,
productivity.
yeah, and lost productivity as a
It is
result of the
affecting
COVID transmission.
Labor affects businesses.
But they're assuming the part that we want to know about, right?
Let me just, I'll get back to you on that. I'll read the actual
So
report.
can I comment on actually, I apologize. Senpai Chow is next. I apologize.
I want sourcing support first, and after that, Senpai.
Oh, sorry, just to quickly interject, I have found a more relevant article here.
After, real quick,
sorry,
right after sourcing support, please.
So this is really more for my libertarian brothers. Because I have a lot of libertarian leanings as well, and I share your concern about these mandates on individuals. I do think that it is a scary precedent to set. And so I also agree that largely we can solve the issue by having businesses require masks. So would you be open to the idea of the state requiring businesses to require masks and enforce it at that level? And if they fail to do so, there would be fines and maybe even loss of business license associated with that. Because that seems to me like it would take care of 80% of the issue, while also maintaining an individual's right to, conduct themselves out in the open as they wish.
I would not be open to that.
No, I wouldn't either.
But you are. So I guess you think businesses can handle it just on their own, but aren't okay with telling.
I'm fine letting businesses choose, and then people choose which, whether they want to go to businesses that.
But what happens?
Or don't.
Yeah. Okay.
Exactly.
That makes sense. But
Yeah.
I'm trying to understand then how we actually achieve the reduction in spread if not everyone is doing the needful.
Well, why do you say that not everyone is doing it? I mean,
well,
if you leave it up to governments, like, there's no particular reason to think that a government is more inclined to make policy that's going to, make the right policy versus a business, right?
I mean, I don't know about no reason, but I'm not claiming
a reason.
Yeah. I'm not claiming one. Okay. You're making the claim. I'm just saying.
Why not?
That's the case.
I'm saying if you trust the government generally to make those policies, why don't you trust businesses to make those policies? And then therefore giving you more flexibility and allowing businesses to adapt to, for example, local differences in the situation, differences in the nature of the business. Maybe there's some particular reason they need masks more than most businesses or less or whatever.
Well, I'm taking the lead from what you're saying about businesses being a good place to implement this. And I'm just saying for those businesses which are not being responsible, it might be a good idea to go ahead and add the layer to ensure that they are.
No, I don't think so. I think people there's already a mechanism for holding those businesses accountable, and that's the fact that you don't have to go to those businesses. I mean, you can tell whether a business requires masks or not before you even go in the door. So, and people are willing to take the risk of going to a business.
But that doesn't address the issue that I'm talking about when we're trying to achieve full lockdown of the virus spreading. And if not everyone is participating in this, or at least not an overwhelming majority are participating here, then we still have the same problem that we had, which is not requiring anything. Do we not? Because can we really rely on rational actors?
So no, you're saying you want to just decide what everyone is going to do, but you can't.
No,
decide.
I'm saying we can decide what the businesses do because the businesses are licensed by the state and the state has authority over the businesses.
Yeah, but you can't actually decide what the businesses do. I mean, you can decide what you think the state should do and try to get the state to do it, and then the state can try to get to enforce the law that you made, and so on and so on so forth. Like
But I have
in
some.
your model, you're just sort of assuming that what you decide is what happens, and whereas through my model, you're accounting for the fact that people may not do what I decide.
And we have evidence. Sorry, I just posted a couple of studies in, or one article and one study in chat that indicates that yes, state mandates are effective at both increasing mask usage and reducing COVID transmission. So, like, unless you want to argue against against the empirical evidence, I mean, if you want, we can dive into it. It's there have been a couple of studies looking at natural experiments here, comparing different locales that have implemented masks versus those that haven't, and I mean, it's a pretty substantial effect.
Well, so I mean, the difficulty in doing a study like that, it seems to me, would be the controls, right?
Well, yeah, that's why it's a natural experiment. The controls obviously aren't perfect, but if you compare a bunch of regions that have got mask mandates with a bunch of similar regions that haven't, you cut down a lot of potentially confounding variables there. Obviously, it's not perfect, but like intuitively, it seems that laws have an effect, unless you want to argue that people don't respond to state violence-related incentives at all.
I mean, often they don't, but I mean, this is like whether people will follow the law or not is actually not my main concern. My main concern is just, I don't think it's the business of the government to make these
okay, but that was the claim you were making a few minutes ago, though, wasn't it?
The claim I was making that it wouldn't be so in response to Sourcing Support's claim that that we needed to do this in order to fix the people who weren't complying, I pointed out that there's no guarantee that his method would result in people complying either.
Okay, but there does seem to be some evidence of that, at least. So, I mean, don't get me wrong, if you want to stand on principle, that's absolutely fine. I support standing on principle if you've got strong principle, but I think the consequentialist case is fairly clear here.
Okay, well, I mean, I have to look at these studies to see.
Fair enough.
But
so I work.
Sorry to interject. I think CityCat's had a hand up for a while.
Yeah. CityCats, then Beyond the Tags, and Road Break. After that, you can engage.
Yeah. So I think that I think I heard civil liberties mentioned and things like that, and I just want to say that that's a very stupid kind of argument. Yeah, sure, masks are slightly inconvenient, but so is underpants, and it's illegal to walk around without underpants on. It's just, and I feel like there is data to prove that mask mandates result in less COVID spread, and isn't that the only thing that matters in this situation? That there are less cases and that less people die. I wanted to say as well, I'm high risk, I'm immunocompromised, I'm immunosuppressed, and I feel like it is the responsibility of seatbelts are a great example. Thank you so much, Senpai Chow. It's the able-bodied and abled people's responsibilities to take care of people like me, who literally, if I got sick with COVID, I would die. And I don't want to die just because some people are but it's my freedom to not wear a mask. And with the whole, it should be the business owner's choice, I think that's stupid, because if you live in a conservative town, it's likely that your two shopping centers that are near you are going to be where you buy your groceries, they're going to both be we don't care about masks. And then people like me don't have somewhere safe to go anymore because nowhere around us will have mask mandates. So I feel like that's all I wanted to say.
Yeah, I feel that too. My immune system fucking sucks.
Yeah, go ahead, Beyond the Tag.
I've been working through this. I did get furloughed for a while. Now, when this first started, even though I'm not the biggest fan of masks, but that's in my area because, I mean, such a small place. I donated 350 masks. I made 350 masks to give out to people who are less fortunate to be able to have them or get them because that whole price gouging and stuff. So I do want to be able to. I did try to provide that for people who couldn't provide it for themselves, and that's as American people, we need to look out for each other in that sense. But forcing someone to do something that, not saying that you can't do it yourself, right? But something that you may need help with, just like you were saying with the grocery store and stuff like that. I think that there are stores that do, they do paper bags, they do plastic bags, they do reusable bags. Forcing that on a company to change their ways of means and stuff like that is, I mean, unless the government's going to give them all this money to do it, or when they start dropping off profits because their customers don't agree with it, unless they're going to make up for that profit, or that loss, I don't think that a company should be forced to do anything. Now they should have incentives to do it. Hey, if you guys go fully COVID protection and stuff like that, then hey, we can, boom, 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 and help you out with, this and that, and give you like a tax break or something like that, because it's a safe place for everyone to go and stuff like that, possibly. And that's up to the business to choose. But now, like I said before, what about, and Kat brought up a good point. What about people who can't wear masks? We're going to mandate masks, but now somebody who has asthma, he can't go anywhere because
No,
he
no,
has to
that's
wear
not
a
a
mask.
thing.
That is false.
That's
Math
not a
does
thing.
not
Hold on,
reduce
hold on.
There
oxygen
are
levels.
there
Hold
are
on.
there
Now,
are no medical conditions out there that require you to not wear a mask. That
what
was
about
made up by white middle-aged conservative women on Facebook who were like, if you go up to your grocery store and say you have a medical condition, they legally have to let you in. It's stupid and it's not real.
So
But what about, hold on, what about that old person that has tubes for oxygen in his nose? Is he supposed to wear a mask? And
sorry,
how do
yeah,
we, with stuff like that, with HIPAA, like how do we? That's what I'm saying too. Like, are we gonna force everyone
Okay,
to do it?
I don't know
Because
about
Yeah.
HIPAA, but I do have a degree in medical science, and if we're talking about people who can't wear masks, there do exist some of them, but we're talking about the kind of people who have such impaired pulmonary function that they're going to be carrying around an oxygen canister. We're not discussing like people with a bit of asthma or with people with a bit of COPD. Like, yeah, there probably are a few outlying cases in the sense that there are still some people in iron lungs, but we probably don't need to be like seriously considering them as anything more than an edge case.
But what I'm saying is we have to do this on an equal level. If we are going to do anything, we have to look out for everyone. Now, there's a lot of opportunities, though. I mean, you were talking about where do you get your food at, Kat? I mean, they have services for those still, and a lot of them do curbside. I've been working through the pandemic. I've only had one person complain about wearing a face mask, and I just told him, hey, that's our company policy. He kind of got a little upset, but he said, all right, whatever. He got a mask and came back in, and that was it. Only one customer was like that. Everyone else, and I offered, hey, we have curbside assistance, and I've had another person say he had a medical issue, and you can't ask what the medical issue is and stuff like that. But and I just said, hey, do you have a doctor's note that prevents you from wearing a mask? He couldn't answer. He couldn't be in the store. So it is the store policy to kind of break up what you guys are saying. But now, if I'm walking around on the street as just an American citizen or wherever you are and demanding other people are following this as an individual from, say, the government that can't really even enforce it, I think that's kind of ridiculous. And like I said, I think that if a company wants to, just like I said before, switching from paper bags to plastic bag or whatever, it should be the company, and there should be maybe a benefit from that, sure, but they shouldn't be forced to, because some companies, they're brand new. They can't afford doing all this PVP and all this other, protective shields. Like I just got a protective shield on my store. We've been open during the entire pandemic. We didn't shut down because I'm actually an essential worker. We didn't have that little break, but some companies are small. They can't afford it and they're losing businesses. So, but that's just my take on it. I mean, I don't know.
Sorry, you
Not
keep
all
on saying
companies
this
being
is
able to do it
my
is
apologies.
just another reason why the government should step in and intervene and provide masks and provide this type of personal protection equipment.
Yeah, and you keep on saying this is unenforceable, but I think it's about as enforceable as any one of the many like minor pieces of legislation, the little local ordinances and state laws that exist in the US. People that it's trivially easy for the police to enforce. Again, going back to the law about wearing pants all the time, that's not very difficult to enforce. So I don't see why wearing a mask would be anything different. Also, I don't think anyone here is strongly arguing in favour of mandating it outside all the time, at least based on the work looking at transmission indoors is far more risky. So I would personally at least not support a rigid mask ban outdoors, except in maybe the highest risk areas.
So right,
There are
sorry
many
to interrupt.
laws that are not enforceable, right? I mean, tons and tons of laws that people break all the time without knowing it.
Yeah, but I don't think this is one of them.
I'm
Yeah,
just
and I
looking
think
at the
there's plenty of
study that you
examples.
posted, and so basically it says, counties in particular states that had mask mandates saw a significant reduction in coronavirus compared to counties that didn't. That could suggest that the law is effective in reducing the coronavirus through the mask mandates. But it could also be that it's just that the government just making the law is serving as a signal to people to convince them to wear masks. So I mean,
Well, that would be a benefit of it,
intent,
surely. I think
Okay,
a
it
better
would be a benefit. It would,
because,
but
the
it's
kind
not
of phrasing is
necessarily a
wrong.
benefit of the force of the law. It could just be a benefit of the government saying, "Hey, it's really important that you wear a mask for public health." To really do this properly, I'd like to see a comparison between the government making a law versus just saying to people, we're not going to make a law, but it's really important that you wear a mask.
Right, sure. And I would certainly support such research being done. But given the state of the pandemic, the fact that it hasn't been going on that long and research does take a long time to do, this is probably the best evidence we're going to get so far, and we need to make decisions based on limited evidence, given the very pressing nature of the problem. So while I would absolutely support more research,
Hold on. I need to
sorry.
interject because last username said something that was really, really, really wrong. Okay, so the reason why counties with high percentage of people wearing masks and also them having high severity of COVID cases is because those are urban areas. And if we know anything about logic or demography or anything about population density, we know that during pandemics, urban areas are going to get hit the hardest because of that high population density. And then the low risk areas which has low amount of people wearing masks, those are rural areas. So then like places where beyond the tags are living, where the cases are low, the deaths are low, etc., etc. Correlating that like an area with high masks
No,
having
this study
high
did control for that.
having
Yeah,
high
this is not-
COVID cases,
I'm just
saying that
regurgitating what the study
because
said.
of high mask usage, they're having high COVID cases. That's wrong.
I
Unless
don't think he said that.
No,
I mean, I don't think he said that.
I didn't say that. The study says that the counties that had legal mask mandates saw a significant reduction in COVID cases compared to the counties that didn't, and I assume they controlled for the.
They did control for population density, yeah.
So I want to make a quick comment real quick, because right now I'm in the UK, and the UK has the mask mandate requiring that if you're out in public, you have to wear a mask. And when I say in public, I mean in stores. If you're walking down the street, no one gives a shit. But if you're going to be in a store, there is a requirement that you have to wear a mask. And the caseload numbers are, they're better than the US at the moment, obviously. But I think that there are plenty of examples of why how are we going to enforce this, right? I'm often on the tube and I'm looking at fools and I'm like, do you understand how freaking masks work? It's not supposed to sit down here, asswipe. So like, practically speaking, that if you are going to wear a mask, that's okay. I'm for that. But if you're going to flaunt the rules, just flaunt it completely. Okay. So like, I understand the concern about like nitpicking about like, how are we going to follow through? How are we going to regulate? These are reasonable things, because a lot of people will not follow the rules, right? But I think it goes to what last username and post normal was just saying, is it's the signal that we're pushing out there. So maybe it's not even a regulation. Okay. Like, okay, fine. But at least let's push for this notion that we can accept the idea that there is a benefit to it, that there is a way that we might reduce, I guess the case spread just in general. Like I'm even okay with not regulating it, but I think there is precedent for it.
Yeah. I mean, that's the thing. Like, probably at the end of the day, this is something that doesn't matter to me all that much, because I know that people are probably going to be wearing masks anyway, and why they wear it, whether they wear it because they're afraid of the law or whether they do it because of a sense of personal responsibility, is probably just an academic issue. like, there's a law that says you have to wear pants, but I know that if that law didn't exist, about the same amount of people would wear pants anyway. So I don't really care about that law very much.
Speak for
And it's
yourself.
probably going to end up as a similar situation with this law. But I will nonetheless argue that I don't think there's any need for the government to create this law.
I think there does. So currently, right now, at least according to the Pew Research Center, only 65% of respondents said that they saw people wearing masks all or most of the time, and 15% said that they only saw people wear masks some of the time. This number could definitely improve to the likes of, say,
Is that
Japan
indoors?
or other Asian countries such as Taiwan, if you want to consider Taiwan as a country. Never mind that. And like,
Was that
there is
indoors though?
no,
they
they
ask
did not
people?
differentiate indoors or outdoors. I really don't see there is a difference between how it spreads indoors and outdoors, but being in contact or close proximity, like with somebody outdoors and like them breathing on you or sneezing on you, etc., you can still catch COVID. There's still a risk even if you are outdoors.
Yeah, but I don't
So-
think any of the laws mandate that you wear a mask outdoors. I don't think anyone is really serious.
That's probably an outdoor event or like
Yeah, unless it's
like
like
a
a
flea
particular-
market, like a flea market, for
Yeah,
instance. With
like
the
generally walking down the street or something.
But
Trying
my
to social
question,
distance.
my question is this, okay? Let's just say we make it mandatory. All right. My question is this: what is going to be the consequence, and where does that, like, what should be the consequence if you don't wear a mask because you don't think where you're at is defined? What, say you are in a parking lot, right? You're still technically on the company property. You're not inside, but you're not technically out in public yet because you're still on the property. You have to wear a mask, and if a cop deems that you're in violation of this law, right? What would be the consequence be?
Probably a
I
fine.
mean, yeah, I think it's typically like a fine.
And now, where would that money from the fine go? To
Well,
provide masks for people, or is that just going to go in the
Sure,
government?
it would-
Usually it just goes into the police's pocket, doesn't it?
I think these questions are
Wherever
kind of
fines
real
usually
quick.
go, but like
Real quick, 5 minutes left on this topic. After that, we'll go to closing statement. I'm going to throw it to the city cat.
Yeah, I just want to say that putting a fine as like the thing for if you get caught wearing a mask and not wearing a mask, what happens to you? I think that's a bad idea because that's just like another thing for poor people that they have to pay, and like middle class rich white people are just gonna be like, well, if I don't want to wear a mask, I'm just gonna pay the fine, and then it's just gonna be like a tax on poor people who either can't afford masks or yeah, so I feel like I feel like a fine would be a bad idea.
And a cash cow for the police, which fines already are for many other laws, which is one of the things that should be considered when making a law like this, right?
Yeah.
And then there's also going to be issues of like, why is this particular people getting more tickets in this area than this place? And I think it's just going to open up a can of worms, personally.
Like there are places where people get fines for like having the wrong houses painted the wrong color or blinds being the wrong direction or something.
But I
you don't want
think
to end
that,
up
like,
with a situation like that, right?
Yeah, I think that the best kind of idea with something like this would be to like sorry, I'm so out of it. It would be to instead of have it be like an out in public thing, just have it inside like businesses and things like that. So then the punishment for not wearing a mask would just be like removal from the business and like not being allowed to be here instead of it. Pardon?
that seems potentially worse than fines, at least in some instances, in that if you're in like a small town with relatively few businesses, getting, banned from several
Not
of them.
necessarily getting banned. It's just like and I feel like businesses should have masks probably provided by the government. I'm not sure how much the US does for things like that, but in Australia, like we kind of just gave all of our small businesses money to help them with things like this.
I mean, I'd support that, yeah, certainly.
Yeah, exactly. So I feel like if there's a business who's like, hey, we have masks, if you like put this on, and if they don't put it on, I think saying you're not allowed to come in until you put this on is like the best idea to like regulate this.
Could have
rather than it being a fine or something.
Someone in my chat just proposed community service emptying bedpans on COVID wards.
Well, my whole thing is too when you police go to a place and they want to trespass, they have to ask the owner's permission to even remove that person trespassing. So I think personally, I'm hearing that it sounds like all of us can agree that it seems like the business has the final decision, and so therefore the business should be the if they are going to mandate masks or not, because they're the only ones that can remove people from their business.
I don't think we agree on that.
We don't
Hey, then
agree.
here's a whataboutism. What about public parks?
I've been hearing about it. Always
What
comes
about
back down
beaches?
to the business. Well, the
What about
business
streets?
is whatever that I don't know what they're called, but they regulate the beaches and stuff like that. They can shut them down if they wanted to.
Public beaches, owned by
They-
the state,
oh, they-
run by the state.
Oh, they can still be shut down though.
Yeah, we closed all of our beaches.
Yeah.
And no one was allowed on them. I think that that's probably the most responsible thing to do, is to close any big public parks that could have a gathering like that, or big public beaches, and especially like fucking Disneyland. I cannot believe that that is open. But anywhere that could have large groups of crowds should just be closed in the US right now, because holy shit, you guys are out of control. And from an outsider's perspective, looking at you guys, it's just kind of like I can't fathom how people are still like, but should we or should we not wear a mask? Like, you guys are all gonna die. Fuck,
Not all
close
of
the
us.
beaches, close the
It'll be
parks.
okay.
Yeah,
Let's
for that.
not get everyone sick. Jesus Christ.
I mean,
Well,
as
Yeah,
I,
but I don't think it's worth it. Like, you know, like, don't get me wrong. I'm in the camp of wear a mask, right? But I don't think it's productive to just go ahead and like crap on people who have the you know, the skepticism to ask about the liberties, right? Like I understand where they're coming from. I don't support it, but I don't think there's a need to shat on them.
Sorry, I feel like shaming people who aren't wearing masks is a good way to get them to wear a mask.
Well,
I think
then
that's
can
probably
we?
not productive.
Probably not. It makes it more of, I suspect it makes it more of a like culture war issue, which is part of the reason why, for some reason the right on the US, I don't necessarily mean everyone on here, but a lot of people on the right on the US have kind of gone absolutely mad about
No,
this.
yeah, I totally agree. And that would be like my
interesting
only
point.
point against like a mandate, is that it would make like the right be like, we're being muzzled by Democrats. And I feel like giving them ways to say things like that is a bit but I feel like is it worth it? Is it worth it to like just have the right? Because I feel like they're gonna do stuff like that anyway.
so this is
Real
a very
quick.
good point. Sorry, go ahead.
Yeah, we're going to finish on that statement, on that topic, basically, and start the closing statement. If you want to answer to what City Cat say, you can do it in the closing statement. Please don't interrupt. Please don't start a back and forth. If you want to respond to something being said in the closing statement, you can do it in the opening statement for the next topic. So we're going to start right now by last username.
Okay, so yeah, on that point, there is an effect of shaming people. I think shaming people into wearing masks does work if it happens sort of socially, but when it gets political, that's when you get this kind of polarizing and this kind of backlash. When people sense that there's like the sort of tribe, like one tribe is trying to get them to wear masks, then you tend to get this sort of other tribe trying to push back against it and consolidate behind not wearing masks, which is not a good thing. So this is, I think, another good reason to try to keep the government out of it and let these sort of social norms evolve naturally. Is that you'll tend to get more cohesion and more compliance on it, and tend to avoid this kind of polarizing effect. Like there definitely is the sort of tribal movement against masks. I don't think it's significant either. I think most people are on board with masks in the U.S. As I understand it, but still, there's definitely a sort of tribal anti-mask sentiment out there, which is silly. That shouldn't exist. There's no reason for that to exist, and I think you can blame government intervention on that. So that's a negative consequence of getting the government involved. Okay.
Right. Sourcing support.
Yeah, I mean, I'll keep it short. I'm happy that at least we have everyone in agreement that masks are beneficial and a good thing and something we should support. I was hoping to see some common ground here around asking or forcing businesses to implement these things, and then using the state and its power over its entities like parks to shore up another portion of that, and hoping that's enough. But oh well. Yep.
All right. Beyond the tags.
I just, like I said, I believe that it's up to the people's responsibility to kind of look out for each other. If you have a business that is super supportive of, their local people, then they should want to do these changes. They should want to mandate these masks. But I believe that forcing someone to do it is, just stripping them away from their individuality and just their access to whatever. And but I do believe that us as people working together, providing masks for each other, providing the ability to go grocery shopping that people are even more at high risk, I think is a good thing. And I think that anyone who's put in that position would appreciate that, because we got to look out for each other. At the end of the day, we're all human, and we all need to look out for each other regardless what you think. But I think that we the people should do it, not ask for daddy government to do it for us.
All right. Senpai Chow.
According to the Institute for Health Metrics and Evaluation, if we were to establish universal mask mandates, meaning like 100% of people in the United States wore masks, we would be preventing thousands and thousands of infections as well as deaths going on to the years until we receive some sort of a vaccine, and then we're able to have this all blow over. The science is real. Masks work. And according to the Pew Research Center, only 65% of Americans see other people wearing masks. I don't know if people are going to be harping, oh, well, do they distinguish between indoors and outdoors? Who the fuck cares? That means that there are a lot of people who aren't wearing masks. And I see that a lot of that number could be improved. It could go up. And when I am arguing for mandatory masks, I'm not expecting for us to be reaching 100%. That's an impossibility. No country in the world, even Japan, with it so much culture ingrained in people wearing masks when they're sick or have the common cold, they're not even able to get 100%. But increasing that number, increasing that percentage is going to save so many lives. And I think it's worth it. A very basic political theory concept is the social contract between the government and the people. Yes, the people are responsible to protect their communities and each other. Yes, businesses are responsible for protecting their customers. The same thing for the government. The government is responsible for protecting its people within its borders. In our own constitution, the preamble reads, "We the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare." I think that is enough to say that the government has a responsibility to look out for the common good of the people. And if that's going to be coming at the cost of mask mandates, and if that's going to have like us reducing our liberties, so be it, because that's the social contract. We give the governments some abilities for them to oversee us and our security at a higher level.
All right. Red, gray, blue.
I fully agree that masks should be worn in public, and I believe that the states should do as they need to require, to do that. And I think they're well within their rights to do so. So I think promoting, a general public well-being by like mandating or at least aggressively suggesting that you wear a mask, I think is a healthy and productive thing for society. However, I don't think that necessarily the criticisms of the individual liberties thing is I guess unjustified, but I think there is some ground to it. However, it seems that when you look at some of these individual liberties things, it proposes very little solutions as to addressing the problem. And I think fundamentally, if we're just going to sit on our hands and just say at the end of the day, oh, okay, well, it's going to infringe on our liberties, so we won't do anything, then I think we've pretty much ignored the reality of what our history has taught us, specifically around the United States doing a wide variety of things to infringe on basic human rights in order to make sure that they could protect a broader, greater community other than the individual, and they've done that so many times throughout history. So, like, not saying that it's completely justified to infringe upon these things, but I think it's worth asking the question is like, okay, so are we just going to sit still then? Is this the end of our productive, attempt at solving this public health crisis? So yeah, that's my stance, and I think it should be mandated in the appropriate areas.
All right, post normal.
Yeah, so I would like to echo sourcing support in that it is nice that everyone basically agrees on the fundamental utility of masks, even if we disagree on what to do with them. I came prepared with a bunch of very basic biomedical evidence for why masks are actually a good thing, so I didn't have to bring that out. But yeah, I think if there's anything that justifies the use of government force, it's this kind of very difficult health coordination problem where we need a lot of people engaging in a pretty simple behaviour, and we need to motivate them to do that, whether through like positive or coercive means. I agree that the civil liberty issue is important and not something that we should be just dispensing with, but the sheer efficacy of masks, the sheer positive impact that basically all epidemiologists agree on, and that the evidence I present indicates could be improved with government intervention, means that I think we've got to, or at least you lot in the US have got to implement a mask ban if you don't want to, be having thousands of people dying every week. So yeah, mask ban would be good. Mask ban? Mandatory masks even. Sorry, I'm just flipping around my entire position. Also, last username's cat is delightful.
True. Brent Obax.
Yeah, I mean, I do support. I support some like mask mandates, in particularly in government buildings, things like that. Essentially, where the government already has authority. I guess I just have, and I think many people just have reservations about extending that to what's being talked about in Washington State and other states where 100% mask requirement when outdoors at all times. That seems almost stupid. Just it seems blanket and excessive. And when it gets to that point, it seems like how could something like that be evenly enforced? So those are the types of measures that I kind of worry about. Living in Seattle, we're pretty liberal, progressive, and I see pretty much, well, not everyone actually, but most people wearing masks. Everyone indoors in like a public setting wears masks. A lot of people walk around without them as long as you're not walking, with someone. And so I guess it's just the question of how far can the government go in mandating and extending these things. And when you hear things like saying mandatory masks outdoors at all times, it just seems like a blanket overreach.
All right, and the city cat.
Yeah, I'm all for like a mandatory mask thing. I think I've made my position pretty clear on this. Yeah, I think I don't want to be taxing just poor people. I think that a big thing that would help this would be more like government subsidies towards businesses that are trying to stay open during the pandemic. I also think that a lot of restaurants should just be like straight up closed. I think a lot of states in the US should go back to like stage one of just having essential shops open. But yeah, if you are going to have all of these other things open, I think the least you can do is mandate that you have to wear masks in these shops.
All right. All right. Let's jump on the next topic. Before that, I want to say Hippy Dippy podcast is taking place on Dylan Burns TV every Friday, 8 p.m. EST. Don't forget to tune in. And yeah, let's jump right in the next topic, which is should health insurance be obligated to cover birth control? And since Red, Gray, Blue just bribed me, I'm going to start by him.
See, this is the power. No, I'm kidding. I have a question actually, though. Like, is this in context of government healthcare, or is this in terms of just like private healthcare? Like, to frame the question.
Sorry, come again.
So, with regards to mandating, I guess, birth control in healthcare, are we talking about in terms of the government provided healthcare services, or are we saying that all private healthcare programs need to offer that? I'm just trying to understand what the question is specifically.
Government.
Oh, okay. Yeah. So as far as the government programs go, I think that if they're going to, I think there should be at least some semblance of birth control policy in that, because I think it is manifestedly a issue that actually has a lot of cost to the taxpayer at the end of the day if an individual on healthcare from the government does not have access to these basic family planning resources, honestly. So I think that there's a lot of questions that can manifest themselves probably around the abortion topic specifically, and so like what level of care is provided there. So I think my opinion there is probably a little bit more nuanced when it comes to abortion. I don't necessarily believe the government should be interfering with the decision of the woman to do whatever it is with their body. However, I do question some of the things around late term and like further along in the pregnancy. I do have qualms around that, but that is my personal belief as well. So I think there's at least some common ground around like contraceptives and the basic pill itself. I think that's something that I could get behind without too much fuss.
All right. Post-normal.
Yeah, so when it comes to the insurance issue, I know very little about how US insurance works. It all seems quite convoluted and messy. So instead, I would just focus on the fact that birth control is one of the greatest biomedical inventions of the 20th century. Um, I've got a bunch of evidence here that I can present in a bit, but essentially it improves people's ability to make decisions about their lives, tending to lead to later births, better financial quality of life outcomes, higher GDP for nations that introduce it. I mean, it's just like unambiguously a wonderful thing from many perspectives. And I would generally support any measures that make it more widely available. I also think it's important to note a couple of complications here. First of all, when we talk about birth control, we're not just talking about pills that stop you getting pregnant. We're talking about biomedical interventions that are used for a wide range of disorders. So hormone therapy for trans people, control of menstruation for various health or lifestyle reasons, menopause, which can occur very early. It's not just people in their like 50s, 60s who are experiencing menopause. And furthermore, while currently it's only people with ovaries and wombs who have access to widespread access to birth control, there are a bunch of interventions, notably RISUG, if you Google RISUG, that will enable people with testes and penises to have ongoing birth control. So I think it's worth remembering, this isn't just something for the opposite sex. It's something that we can all benefit from, and indeed we all benefit from, increased GDP and from increased access from women to the workforce and so on and so forth. So yeah, I don't know how it should fit into the US insurance system, but I'm a big fan of birth control from a non-antinatalist perspective. I think more children is good. It's just also good that we have them not necessarily later, but have them when we want.
Okay. Let's use a name.
So this question has becomes a very different thing in the context of the ACA, which is the American Healthcare Law, versus in general. So in a free market for insurance, there'd be no reason for the government to mandate that insurance cover a particular thing. Insurance could just could offer to cover whatever things, anything for, and that would affect the premiums. And then customers of that insurance can choose what coverage they want, and they have to trade off for how much they want to pay for the coverage. And I would tend to think that they would often, birth control seems like the thing that you'd often choose not. It doesn't seem like there'd be an advantage to covering that through insurance, since it's not an unexpected cost, at least for the typical usage of birth control. It's something that you're going to, when you're going to have to, that it's going to cost you, you're going to have to cover it. It's not like an emergency thing that pops up unexpectedly and you suddenly have this huge medical cost in the usual case. So in the ACA, however, it's in America, there's this, the law says basically the way the ACA works is it's like a trade between insurance companies and the public. The public says everyone has to have insurance, and the insurance companies say in exchange for that, insurance has to accept anyone who needs it. You can't reject people because of pre-existing conditions, right? So it's like those are like two sides of the same coin. But now they got rid of the individual mandate, so they kind of broke one side of the coin already. But putting that aside, the other side of the coin requires, if you're going to require that, well, if you're going to require that everyone have insurance, you're also going to have to require mandate that what insurance is, right? Insurance can't just be nothing. So you have to actually say, well, insurance has to cover these minimal things. And then is it reasonable to cover birth control? I mean, I guess under that arrangement, it sort of makes sense if you accept this. If you accept the ACA, I don't think ACA was a very good idea, but it makes sense within the context of the ACA to mandate birth control coverage. I guess I don't know. It's hard to say because you have to get into your. I don't even accept the idea of the ACA, but in a free market for insurance, there's no particular reason insurance should cover birth control, right? It's not an emergency, not an unexpected expense. It's not, you're not eliminating any risk by having insurance cover birth control.
I would. Oh, sorry, it's opening statements. My apologies.
Yeah. City Cat.
Yeah, I don't know. I'm not American, clearly. I don't think that insurance is just for emergencies. Like if you're as someone who's born with a chronic illness, that wasn't like something that came out of nowhere and is an emergency, but I have this ongoing medication that I take that's covered by my insurance. It's actually covered by the universal insurance that we have in Australia, which I think America should adopt. But birth control, I also want to point out that condoms are a form of birth control, and I feel like they should be covered as well, because that will stop STDs and things like that, the spread of STDs a lot among teenagers and things like that, which goes hand in hand with sex education and things like that. So I feel like all of this should be covered by some kind of insurance, or at least just be like, because or at least just be like free, you know what I mean? Like I also feel like tampons and pads should be free, just like paid for by taxes through the government, because it's not something that, like, as a woman I don't get to decide like if I need the birth control or not. I need it to regulate my hormones, and I need it to regulate my menstrual cycle, and I need it to to like help with a bunch of other medical things that I have. So I feel like it's not fair to say that like this one thing that only applies to women, they have to pay for that and it's not covered by the insurance. When like if everyone was getting pregnant and needed this, then I'm pretty sure that it would be like, oh yeah, no, everyone needs insurance. It would be like if women were the only people who had eyesight problems and needed glasses. It would be like, well, why would we ever cover optical through insurance? Why would we ever do that? It's only a women's thing. But because everyone struggles with things like that, insurance sometimes covers optical. So like, yeah, I feel like it's definitely something that needs to be covered in insurance.
All right. Brent about.
Last username said it really well in that, like in a free market, when there's no government provided healthcare, like then you would only sign up with the healthcare that you actually needed or that you wanted. I guess also that you could get, really. So that's a point too. But whether or not a health insurance should cover something would be a question of what health insurance you have, not whether or not like it's mandatory, right? Under the ACA or under, I do think that under a government mandated healthcare system, I do think that birth control would probably just fall under just health. I guess the health of the individual. I think that's something that's actually relatively cheap to provide, and that would probably save individuals and families costs overall. It seems like a fairly simple question, actually.
All right. So thanks, you, Paul.
So it's a complicated question because it's also in the context of the United States health insurance system. I would say that both private health insurance companies as well as government healthcare systems have a financial interest in providing health or contraceptive services, and there's data to support this. There was a Brookings Institute study that showed in Medicaid there was like a 500% return on the investment. I mean, it would follow, right? Like if people are having that, if they don't have the cost of having a child, then they're going to have a lot less cost overall in the length of their contract with the insurance company. That being said, given that health insurance companies don't always provide this, it brings into question the idea of, is health insurance about providing people with healthcare, or is it about something else? And so I mean, that's maybe a different debate, but if we're mandating that an insurance company provides contraceptive services, shouldn't we maybe just have a healthcare system that is managed by the entity that is requiring it?
Okay. Beyond the tags.
I think that personally, I mean, if you don't want to have a kid, watch what you do. Um, and but now, like Kat was saying, I heard what you said. I know about that. Some people they need to have a lot of people need the hormones to balance out their whatever the case may be. Now that part might be a little separate. I'm not too sure about that because well, I'm not a woman. But I do know that if you get a car or something like that, you have to get insurance, and you have to get the insurance that fits you. Going with the private sector, and this is kind of an experience moment, but when my wife, because me and my wife make too much to get any kind of that whole Obamacare stuff or whatever it is, we don't qualify for any of that, so we have to provide our own. Um, and I get mine through the VA, which is a free system, and it's complete trash. It's garbage. So honestly, free services aren't the best services. But if you want something for something you need, there are services out there, I believe, that you can go to a private sector and say, hey, doc, this is what I need. This is what I provide. This is my lifestyle. And this is something that I need to do. Now, if you're talking about the government mandating it, then they should provide it. I mean, if they're forcing people to have men and women having contraceptive availability, stuff like that, then they should provide it. I mean, they do have Planned Parenthood and stuff like that. They do have resources out there, but if they're gonna make you go from this is what we require you have, then they should at least have some sort of a system in place or allow you to opt out and use your own private system in that kind of way.
And Senpai Joe.
Let's play a game. I'm going to say a few premises. Okay. Increasing access to birth control leads to lower infant mortality, leads to lower amount of unwanted pregnancies. Second premise, a lot of women benefit from getting birth control. Polls have been done, they really like it for a lot of reasons than just not wanting to have a child. The third premise, it is a government responsibility to look out for the betterment of society. And the fourth premise, prescriptive birth control is better and more effective than over the counter birth control. The fifth premise, birth control can be pretty expensive, especially when you stack it up month by month, including copays, doctor visits, etc. So, with all those bearing in mind, I believe that it is the government's responsibility to say that for the betterment of society, having health insurance provide birth control no matter what, including religious reasons, don't care about religious reasons, will lead to a better society and a healthier population.
All right. Did I forget anyone? I don't think I did. All right. You're free to engage.
So I'll just make clear that I assume that we're talking about birth control drugs used for the purpose of birth control. I know that birth control drugs are often used to treat other conditions, but I consider that a completely different issue. And I think most insurance companies do as well. Like it's entirely possible for an insurance company to cover that drug used to treat some medical condition, but not cover it to provide birth control.
Well, it does get quite. Sorry.
I wanted to last username. You were the one that said that if you don't want child issues, just don't have sex, or like watch what you do.
Nope, I didn't say that.
No, that was Beyond.
That was
What
Beyond.
did you say?
Yeah,
Who
that
was it?
Beyond.
Oh, that was me.
Beyond. I'm sorry, lost his name. Beyond. I just wanted to address how insanely idiotic that rhetoric is. As a woman myself, I never ever want to have kids. I have multiple medical conditions that would actually make it incredibly difficult for me to have kids, and probably just straight up impossible. It would threaten my life, it would threaten the child's life. It would just be insanely stupid. And this is a chronic illness, which means it's never going to go away ever. So is your solution me just never ever having sex in my entire life ever, despite how fun and enjoyable it is? Because I think that's insane. Yeah.
No, I mean, you can get your tubes tied. You can have your partner wear a condom. Heck, I mean, risk it and do the pull-out method. I don't know. I mean, it's really up to what you want to do and how you want to risk it. I mean, and there's other things. There's the depot shot. I mean, get your male partner tied or removed. I mean, it's your risk, your health, right? I mean, you should be looking out for yourself and trying to do what you need to do to protect yourself in that situation.
Yeah, I think no. I want to point out that one of the things you said was have your partner wear a condom, which is birth control, which is what we're discussing. Which is like we think that should be
discussing whether or not the government or whether or not insurance should be mandated to pay for it. That's what we're
Yeah. Is it really relevant to talk about
too,
what is a good method of birth control? Like, I don't. It seems like that's kind of derailing the conversation.
He's not saying that you shouldn't use birth control. We're discussing whether or not it should be mandatory to pay for it. I guess you're talking about his take of not having sex if you don't want to have kids. Period.
Yeah,
Well,
yeah,
I
I
mean,
am.
me and my wife,
by saying that,
we're not in anything.
Because I think that saying things like that, it takes away from how important and how like vital birth control is, by just saying that like, oh, it shouldn't, the government shouldn't mandate that insurance companies should pay for it because you can just not have sex. And I think that's I don't think that's very healthy. I'm a very sex positive person. I don't think it's very healthy to just be like, let's just not have sex. It's proven that kind of like teaching of kids that doesn't work either. So I feel like that doesn't go against saying like the insurance companies not paying for it like at all. I think that they definitely should, because sex is like a vital part of romantic relationships. Yeah.
I mean, but what level of birth control are we talking here? Are we talking about contraceptives what exactly are we talking about? Because I mean, when you're talking about having the government provide another service that increases taxes to all people, including me, which I don't exactly would gain from
It
that.
doesn't increase taxes. It would increase the cost of the insurance, presumably, which is distinct from actual taxes. Like
but
if you
even with that, I can't even get the insurance. So so my point is that what line are we talking about? If you need a specialty care, I believe that would be something that maybe something that you need to do, and if you are, at a higher risk. I mean, I don't know. Maybe I'm misunderstanding the
So
question here,
because
but
it's a woman's thing, it has to be specialty care. This isn't
no,
just
you
like a
said you
me
could die
thing.
if you get pregnant, right?
Yeah, probably. But
That's
that was
it's
that was a point against saying that people just shouldn't have sex if they don't want to have kids.
yeah. I mean, you take a man and a woman, you do the naughty, and you have a kid. I mean,
No,
But that's
because
not true.
birth control exists. So actually, most of the time, when you do the naughty, you don't have kids because birth control exists.
yes, but what I'm saying is you have to take it upon your own self to ensure you don't have a kid. Just like condoms aren't 100%, they're only 99, whatever, and then you add a little bit this,
Right,
and you
but
do.
increasing access to birth control makes people more likely to use it, right? We would
But
we would
how's
Yeah.
generally agree on this.
The
Like
access
these,
is all around. Look at
okay,
Planned
but it's
Parenthood.
not
Yeah, it's
though.
not cheap. It's not, and like it's not cheap, and it's
Better
not
job?
completely
I don't know what the
accessible.
question is.
A lot of birth control for women as well. Like you need to go through a whole doctor's process to like get a prescription and everything, and you shouldn't because it's such a basic hormone pill that like pretty much every single woman needs. And unless you have hormone problems that like require a special type of prescription, then women should just be able to go into a pharmacy and get it for free because it's not something that we choose to have. It's something that we need.
So
So
why
the
don't you get a
effective
job that provides that service, or find a private insurance
A
company
job that
that allows
provides
you?
that
Well,
service? No.
Oh yeah, so in
I
the United States, before we thought that the best way to provide everybody health insurance is to have the employers provide that health insurance.
it was quite a
Now
bad
the
that
idea.
seems like really good for unemployed people. I bet they don't have any health problems that they need covering ever.
There's
That's
plenty of
so
jobs open
dumb.
right now.
But I think that's the point of this discussion, right? That's why I asked at the beginning specifically around, is private healthcare or is it government healthcare that we're talking about here, right? Because government healthcare, I think that if you're fundamentally already going to provide government healthcare, then might as well just lump in the benefits of having reproductive, birth control stuff in there. So I don't think it's a question of like private healthcare, because private healthcare is private healthcare. It's a separate issue completely, right? We're not debating the merits of what the United States healthcare system is. That's a completely different topic. What we're talking about right now is specifically government healthcare. Are they providing birth control, or should they not? And I think it really just kind of comes down to the cost benefit analysis that Senpai Chow brought up earlier. Is really just fundamentally, it's going to cost us less money as a society for the taxpayer. And I'm a big believer in low cost, right? That the government should be smaller and that we should try to minimize the ways that we provide social services. And the best way to do that is actually to get it at its root, where women have to find ways to control the birthing process. And so in doing so, you protect future generations, you minimize the abortion issue, you minimize the issues around having children grow up in poor neighborhoods. So, like, you really empower a whole generation of people when you provide these services, if you are already going to do so as a government program. I think I am a big believer in free market and healthcare, but that's not the point of this topic. And I feel like we're just going elsewhere about the morals of the American healthcare system, which, don't get me wrong, we have plenty of problems, but that's not this.
Yeah,
I'm
so
just
I just
saying
wanted to reiterate my take. It's that there should be government healthcare, universal healthcare, and that birth control should be a part of it. I think that with your private healthcare insurance things, you can pick whatever suits you, and I feel like if in that system, maybe it shouldn't be government mandated that every insurance does that, but I feel like at the same time, if you don't, then it's just going to make the ones that provide that more expensive, even though it's not something, and it's just going to be like a tax on women. And I feel like that doesn't take the cost away from the women paying for birth control. It just makes their insurance more expensive. So yeah, I feel like there should be universal healthcare, and birth control should be a part of that.
It's worth
So, I
noting
mean,
that
when you say that,
Here in the United States, we like our Christianity to the point where the Supreme Court has said that if you're an employer and you're Christian and you don't want to provide birth control to your employees because you are Christian, because of your religious values, that's allowed. So there
That's
is an issue of providing birth control.
That's so insane.
Yeah, America can be weird
No
sometimes.
one over here, like on this panel right now. I'm assuming no one agrees with that people should be able to deny other people health things because of their religion.
I don't think not because
I
of
don't think
religion
that's what it said,
specifically,
right?
but so I mean, what you're talking like what this comes down to is should we socialize the cost of birth control, right? Because the effect, if we're talking about America with the ACA, then the effect of mandating that insurance cover birth control is going to be that everyone's premiums goes up, and so effectively, like the birth control doesn't get any cheaper. It's just that the cost is shifted from the people taking the birth control.
Well, it might well get
to
cheaper
everyone.
in that you can engage in like larger scale collective bargaining for lower drug prices, so it might end up a bit cheaper, but you know.
Potentially, but we could probably address that separately. I mean, if it isn't, then the effect is just going to be spreading that cost out. So then the question comes down to, is there some particular reason that we should the costs of birth control should be socialized rather than paid for by the people who
Yeah,
are
I
using
think
it?
that's a
Absolutely.
reasonable crux, and we can make a very good argument in favour of it being socialised. So I think Sourcing Support mentioned something like a 5-to-1 return on investment from a Brookings study. I've also got it's specific to the UK or England, I think, but over 10 years, this study estimates about a 5-to-1 return on investment from birth control. So it has and these benefits are differentiated throughout all of society. So birth control is clearly a biomedical intervention that has a very widespread beneficial effect, not just on the people taking it, but on all of society, because we get, as we were
Who gets the
saying,
return?
pardon?
Return to who?
Return on investment to society. In terms of this study was specifically looking at public expenditures, so the cost of providing birth control on the National Health Service compared to the savings from like lower rates of crime because people are having children later, from lower medical costs in other areas, from like early pregnancies leading to complications, a whole bunch of different ways in which birth control's knock-on effects are positive for the public purse. And then there's probably a bunch more positive effects on society, on people, beyond just the kind of the government's expenditure. So I think there's a pretty strong case, even if we want to overall just save government money, if we want to, tax people less, um, to mandate in some form birth control in order to, provide massive economic benefits. I can link
Yeah, the
this
government's
study
willing
in
to reduce
chat.
taxes by the amount of that that
I
study
mean, they're
says.
probably not, but they'll
I
spend
mean,
it on something
I
else.
guess according to that study, they will anyway. I mean, it's hard to argue against if the government is literally saving money by paying for people's birth control. Then I can't really argue against that economically.
But now, and
So we should
this
also
is my
give homeless
question.
people housing, right?
I don't. I would argue against that economically.
Okay, that's a different thing. Maybe we can debate that in some other time.
I had a question real quick. Just maybe I'm a little off. What is the baseline of birth control we're talking about? Are we talking about like a depot shot? Are we talk about just the pill? Are we talking about a daily pill? Like what do we? Because what is the baseline for what we're talking about? Because I'm kind of curious. Kind of go back a little bit. What do we talk about? What should be provided?
I think it should be everything that has anything to do with birth control. So the daily pill, the morning after pill, condoms, any types of surgeries like getting your tubes tied or
Implants, IUDs.
yeah, implants, IUDs. I forgot the one that the guys get. What's the
Rizug.
name of that one?
Yeah.
Vasectomies.
Vasectomies as well, yeah.
There's actually one that's actually kind of
Yeah, Rizug or Rizug. Reversible inhibition of spermatogenesis under guidance, I think.
Yeah.
Yes, I've heard of that one. I think
Yeah.
they should all be I think they should all be covered by insurance. That's what I consider. birth control,
So
yeah.
I'm a veteran myself. Okay, we have the VA. It is free healthcare to veterans. It is trash. Okay, now this is my thing though. Okay,
Hasn't
so
it been
let's just
chronically
say
underfunded for years?
it's it's that's a whole nother debate. Uh, that's the only topic we need on that one. But no, I think that allowing a certain type of having like the pill, I wouldn't be against it to be able to provide something like that that's low cost that could do the same function. Now, when you start getting into tubes tied or depot shots or stuff like that, where it requires so much more intensive. Some people need this, some people need that, and the cost goes up more per pupil, and this and that. I think that that's where, I mean, because this is where it gets interesting because I'm a dude. Okay. I don't need $200 a month or whatever it costs for birth control. Why should my taxes go up when me and my wife, we needed birth control? We
Because
found
as
our
we just
own
discussed, you
solution,
benefit as well.
but we found our own solution through a private person. We get our what we need to not have a kid provided by ourselves, and we do just fine. But now we gotta be forced to pay a tax
Because
that
all of society
we
benefits, as
do
we just
not get,
discussed. Yeah.
but we don't get it. Like I
All
don't.
right,
No,
this
you
is really
benefit.
I mean,
weird.
I
but,
can't.
like,
I
No,
can't
wait.
get
have
any of
you
that.
I'm gonna
have you
unpack
like
this beyond
ever
beyond.
have you like ever used a condom? Also, like,
Nana.
also like not everyone is in your position to have that privilege of just being like, oh, we went to a private person and got it through them. I feel like you need to be able to look further than yourself and be like, I'm willing to take this tiny little bit more tax so that all of society benefits,
I
including me.
already pay too much tax for HUD, welfare, food stamps. I pay for all this medical stuff I never get a touch. I can't even. I get stuck with the bill in a medical room
Most of your
because I'm a
tax doesn't go
veteran.
to that, but
So,
okay.
And we all
Social
benefit
Security and all that.
from society.
And some
We live
forms I
here.
do benefit from it, yeah. But but what I'm saying is, why raise our taxes when there are things provided out there from companies that will give you essentially a more one-on-one basis? Like, okay, what do you need, and we can provide this through.
Because there's lots of people who
through
can't
company and
afford
stuff.
the intervention that saves society a lot of money. So if we pay for
less
that
accessible.
intervention, then everyone benefits.
Yeah, and where the companies are taking care of it, fine, not an issue. We're just
Yeah.
talking about covering the gaps.
I mean, that's what I'm saying. If they want to provide it, I don't think it should be all, all forms. I think that it should
Why
be
not?
up to a certain limit.
Do you
Because
have
that's
any
What's the
idea how
limit?
much these
gonna
things
be
cost?
no, exactly.
Why are you
And
making
I
this point
mean,
then?
look at the
If you
stimulus
don't know
bill.
how much these things
much
cost
are
so you
relative to each
actually-
other,
taxes for those
why are you
prices?
making the point?
Because because money is not free. This stuff is not free. Someone
Well,
has
no,
to do
but
it. Doctors have to go in. You need gynecologists and all
obviously,
that to administer this stuff. So now you're asking for free doctors that aren't going to be paid by me or you. It's going to be they're going to be paid by a free system.
By
no, the
all of
doctors are paid
us.
by the insurance.
Yeah.
But
Like,
the
I
government-
can't claim to be an expert on US insurance, but I seem to have a better grasp on of this than you.
I mean, look at
And
the Obama phone. How bad was that phone?
what
That's
about
what
the Obama
that
phone?
free phone was. They provided a phone for people who needed a phone, and it was limited, and they can't really do much with it.
Okay.
So
Irrelevant.
when
So
you
is
provide
no
a
phone
service,
better?
increase tax.
Completely irrelevant.
So
All right,
can I'm
beyond.
going to interject
So-
here really quick because I think there's been there's a lot of consensus, at least from the liberal side, like from the issue of cost, though. I think it is a question that is worth discussing. I'm not saying that it's not valid, right? Because I believe that there is a place for this in the government healthcare, right? That if you are already going to get government healthcare, I think it's there, right? I mean that just do it, right? That is the process, that they're already on benefits. Let's just be practical about that and let's move forward with that, right? But there are plenty of examples in post-normal. You had commented earlier, like how severely underfunded is the VA. I would like to point out that the NHS is severely defunded as well,
absolutely.
and it is a constant state of like chaos, right? And it's not
Yep.
like to be critical, because I think there are a lot of good things that come from it, right? But to point out the cost mechanism, I think is a valid concern, because arguably Americans pay less taxes than most other of these countries that are being brought up as examples for healthcare services that are put out there. And Americans, unfortunately, are highly individualistic and don't have the common good as the usual strategy for for play. And so I fully appreciate that we would want to make that change. We want to move towards that. But I think it is practical to say, all right, when we're looking at costs, where's the line that we define as say, this is the service that we're willing to provide? And then beyond that, you know, what else are we doing? Now, don't get me wrong. I think there is a place for having stuff like an actual doctor going in and doing some of these things. But I think some of the elective stuff, such as maybe per se, maybe a man going in for a vasectomy, I don't know that it is the most I don't know that I could fully get behind that fundamentally, because I think there is a level of electiveness to that. Now, if there's a medical need and there's a demand for it, I understand,
I mean,
right? But this is a
electiveness.
minority, like practically speaking, this is a minority of the cases. So I'm not going to build my whole argument around like, oh, you know, there's 5 guys that are going to go in and get a vasectomy next year out of the government program. I think, you know, if it shows that there's a real issue, then we can address it then. But let's just start with the basic services and then move from there. Because practically speaking, you know, American policy needs increments before they're actually going to get anywhere. So, you know, let's not go for this huge win for the farm and say, well, we're going to do all services and let's get this all out there. Because practically speaking, that's not a realistic policy. Like
I mean, it kind of is, because all of these interventions are really cheap.
RGB. Then the question is, at the very end of all this incremental change, what does it look like?
Oh yeah, I mean, that's okay if it evolves to that state, right? But I'm just being practical here. That if you're going to get a policy through, don't expect the evangelical right to suddenly get on board with this notion, right? So let's just start like, you know, I fully appreciate where we want to go, but practically speaking, let's start with a policy that says, all right, we'll cover X, Y, and Z, and then go forward with it. And like, there's no point in honestly like, wow, you're just so immoral, you don't understand humans' rights, you know, you're an abusive person. Like, is this really going to get anywhere? No.
I mean, I'm certainly in favor of incrementalism. If it's impossible politically to get a bill that, you know, provides the whole thing, then yeah, absolutely, we should go bit by bit, sure. But maybe I don't know like American conservatives well enough, but I suspect the objection would be generally to birth control rather than specifically complaining over you know, whether we should have vasectomies or whether we should have IUDs or etc. etc. So it's
like, why continue debating this utopian world where we shoot for these wonderful ideas? Don't get me wrong, really wonderful, but let's start with a policy that we can get forward, and then let's just say, you know, look at like, you know, you guys are giving us examples from Australia, from the UK, fully justified, right? Like genuinely justified. But let's just be practical. Let's look at America as it is, and if we are really going to change a policy there, and you guys have already achieved it in your countries, and that's great, right? But like, America has to do something, and so if you want to propose something, then let's just take it one step at a time.
Certainly in favor of going with things that are politically realistic. But I again, I'm not nearly expert enough in like insurance law or anything, but it seems like just a mandate to provide contraception under medical direction as part of insurance is pretty viable. Maybe if Biden wins, you know, fingers crossed.
But I mean, real quick, I mean, no, we also got to keep in mind that, you know, we're talking about the government provided birth control. I mean, we do have places like Planned Parenthood widely available. Well, maybe not now. I don't know how many they shut down, but you know, those are available, and they have walk-in clinics and stuff like that invited to the public. So are we talking about people who can't get those, or just want to have, you know, like, because those are available to the public. I mean, you can walk in, ask for, you know, this and that, and you know.
I don't think those provide contraception typically, do they?
Yeah, I just wanted to address that.
I'm not sure.
So I've actually looked into this quite a bit in the US, and in some states there was something happening a couple of years back where churches were like buying out Planned Parenthood places and like shutting them down. Also, there's been this uprising of it's called like pregnancy help centers and things like that to help women who are thinking about pregnancy and things like that. And they pretend to be things like abortion clinics, or they pretend like they provide birth control, and it traps women into this they're like evil fake clinics that are trapping women into like just talking to them about absence. And like I feel like relying on people knowing which services are safe to go to and which ones are real isn't good. I feel like that we should be able. I feel like that doesn't take away from the fact that it should be like we should have government like free provided birth control, because like and also these places a lot of the times, like even like real Planned Parenthood places, they might hand out like one condom, that they don't give away like free birth control. um Otherwise everyone would be going to them and it would be a lot more popular. But yeah, I think that was a bit of a misconception there about what those services actually provide.
I do know that they provide more than just condoms.
Yeah, a lot of
Exactly
crisis
before
pregnancy
they
centers is what I was thinking of just then. Thank you so much, Prime. But yeah, so they a lot of the time they provide education on things like that. But it's they do provide education, and they do uh, provide like services that are like, hey, you can go to this doctor and talk about that. But they don't actually give away like birth control for free. So it wouldn't take away from us saying that the government should mandate free birth control.
I was under the impression they did. I don't know. I remember hearing
Well,
they
they don't.
provided multiple things, but I don't know. It's been a while.
Yeah, well,
I
yeah,
want
they
to talk
don't.
about what RGB was saying about like let's be practical, let's do things incrementally, etc. I understand where you're coming from. The thing is that this is kind of like a recent revelation for me, is that we're regular citizens. We are concerned citizens. What is really our duty is not to be forming policy, but is really to have preferences, to voice them out, to influence other people, and then to influence governments. And so then when we are going to be arguing about whether insurance should be covering birth control, this is what we're trying to do. We are trying to convince the other side, people who disagree with it, etc., etc. And so then like sometimes I feel like whenever people do bring up things like incrementalism, yes, sure, it's a very, very important concept, especially when it comes to political theory, but it also does stifle the conversation.
Well,
Is
it's a different
there really a
conversation, right?
conversation going on right now? Because I feel like I hear a lot of one-sided directional towards conservatives just being a smackdown, like, you know, just because, you know, they have a slightly different perspective. I don't know that this is a conversation. And don't get me wrong, like I fully get what you're saying. This is a dialogue and we should propose ideas to go forward and do something. But ideas are honestly puff unless you're actually going to go out and vote for a policy that works. And if you're going to vote for a policy that's so far out there that the moderate base in the United States is not going to get on board, then your vote is also puff. So, you know, practically speaking, let's look at policies that you can actually make work. And I'm not saying that the idea is not good, right? Like I genuinely think it's a great idea. But the problem is you have to deal with the situation that is here. And so if we're going to talk about ideas, why don't we push people to talk about the idea of like, let's get a candidate that might actually do some of these things in the direction that you want, as opposed to shooting for the moon and going for Bernie, who's not going to win.
But we're not.
Bernie can still win.
Why are we going to Bernie? I don't want to go for Bernie.
But see, that's my point. Is like that is an idealism of what this U.S. system could be, and he loses out on the moderates, which is the same notion that we're putting forward here. Is the idea is great, wonderful, but if you're going to
and he's also pushing the overturn window. There's a reason why the Democratic platform currently. This is also getting away from the conversation now. But then, like, that's what we're trying to do. Is that we're not trying to like say, okay, we're not trying to be unrealistic, but by us participating in going out far reach, and perhaps you can say it's unrealistic, it's more so what we're also trying to do is push that overturn window, is trying to influence other people. So then like for us to say, or for you to say that like we have to always think realistically and then we can't propose these things, well, that's also going to decrease the chance of that change going to be even occurring. And like to call this whole conversation a smackdown, I mean, like last username here, he's thinking. Look at him. He's really interested. Rento box, same thing. And then beyond is AFK. And you've also been talking. So like, I don't know. Is there like something against our arguments? I feel like we've convinced last username about like this whole societal benefit thing, like it's economic. Oh, that's the emoji that he's doing. That's very accurate.
I did not say, I think to be very clear, I did not say don't have these ideas. And I did not say don't advocate for these ideas, but I say don't smack down on the incrementalism, right? Like I think push for policies. Like, it's great to have the idea, but at the end of the day, like, push for something that gets to your idea as opposed to the big idea, right? It's kind of like action,
So
words.
here's
So,
my
like,
five-head centrist take. We need both of you. We need people who are talking about moderate, practical solutions, and we need people who are, pushing for the far out there options. Though I think in this case, like, again, maybe I'm very much misjudging American conservatives, but I think this is a fairly moderate shift. We're not talking about like a full socialization of healthcare. We're not even talking about fully social provision of birth control. It's talking about amortizing the cost as part of insurance, which it seems pretty politically achievable.
What a base take.
What would you say is like the main I haven't been saying much, but I don't have too much contention with it. Ultimately, kind of like we were saying, I said in my opening statement, essentially, is that, with the private insurance, you get the private insurance that you want. And if it should include birth control, if that's what you're looking for. And then ultimately now we're kind of talking about socialized healthcare and it feels like I'm actually okay with including birth control under socialized healthcare. Now, I think, does that extend to abortions? And where is this where does that extend to? And if everyone is paying for it in the country, then that's one of the problems. That's where it's like you start hitting friction, and people are like, well, if I'm paying my taxes and my taxes are paying for people to have abortions, and I fundamentally believe abortion is murder, then we hit the skids. And then people
but we all pay for drone strikes and stuff as well, and lots of people believe that's murder. That's just kind of part of.
I mean, that is killing people, but then it comes down. I mean, that's true too, but that's war, and that's sort of like this accepted understanding that that exists.
And abortion is pretty widely accepted. I mean, Roe v. Wade has been around for a while.
I mean,
not widely accepted.
Widely accepted as murder. It's not widely accepted as murder.
Particularly in America.
No, it's not widely. Well, abortion is not widely accepted.
Abortion is pretty widely accepted as being morally acceptable in the US. There's a lot of disagreement with it, but
it's not. It's pretty. America's pretty divided on that issue.
Oh yeah.
Yeah, I think you're underestimating American conservatism again there. Abortion's a pretty heavily debated topic in America, even though I don't believe it should be.
At least the plurality supports it. I may be wrong.
Really
Let's see. Look up Gallup.
This topic is about. If we do want to have the abortion talk, we can do that. But yeah, that's not.
Yeah, I don't think that abortion is really relevant.
Yeah, let's do that at a different time. That's a
yeah.
Well, 79% of people think it should be legal in at least some circumstances. Anyway.
Yeah, in some circumstances.
Yeah, it's a question of whether or not they would pay for it, and that's when it breaks down. I mean, I extended the whole basically the discussion to if should insurance cover contraception, should it cover birth control? And I think most people, well, maybe not most people, but I'm fine with that. Then should government health insurance cover birth control? I'm okay with that too. And then I'm just telling you where it basically runs into contention and it becomes an issue in America.
I'm not saying it's not contentious, but like I say,
sure,
it is very widely accepted that it should be legal in some form. There's just a extremely vocal minority.
I think it's about if you look at whether it should be legal in the current form, like in the current way that is legal, it splits the country about even, like 50-50. But anyway, the issue of birth control, I think this really comes down to morally what you think, what you feel. Like, I think the ACA establishes in America that the purpose of, it turns health insurance into kind of socialized healthcare. That is its purpose. So if we accept that you have socialized healthcare, then I guess the fundamental question is, what does socialized healthcare cover? Does it just cover the unexpected, the risky aspects of health costs, or is it something more than that?
I think that saying that it should only cover the unexpected is, I think maybe you're misspeaking there, because again, there's people with chronic illnesses. So I was in the hospital this morning, right? And that's why I was late. without my insurance, that would have costed me like $16,000 just this morning. And that wasn't like unexpected. Like I knew I was going to need this at some point because I'm chronically ill. That wasn't like an unexpected cost, but it's something that I definitely needed covered by my insurance.
Sure, but I
So-
mean, the point is, it's a risk. Like you don't want to. Nobody wants to go through life knowing that they might have to pay $16,000 all of a sudden, even if they know that they're going to have to pay that at some point. The point is they're going to want to spread out that cost in some way through insurance. So that's understandable, but I don't think birth control really meets that criteria, right? It's a small sort of ongoing cost. It's not something you need. It's not something you need to live, and it's not. It's fairly universal, right?
It's not
I would like to interject. Can I please talk? I'm sorry that I'm taking up so much talking time, but I feel like I need to talk on every point.
You are the only woman on the panel, so like,
yeah,
seems pretty reasonable.
But yeah, saying that women don't need birth control to live is really dumb. I have been on birth control since I was 14 because I need it to like regulate my hormones.
Yeah, but like I said,
and it's
before,
no,
I'm
but
not talking
shut
about. Some people need it to live.
It's like saying that optical shouldn't be covered because you don't need glasses to live. But no, you need glasses to like function in society, right? Like, no, it's not going to kill you if you can't see, but like you still need it to be able to function healthily. Yeah,
well,
like
I mean, you might
yeah,
not. It's not covered in Canada.
I could literally survive without my birth control, but I would be like a mess, and I wouldn't be able to function at work, and it would affect all of my other health problems. So I think saying that just like birth control doesn't meet the criteria of like a medical emergency. I think that's really dumb. I feel like why?
But in your case, it's
just
not,
because
it's not
like
birth
it
control.
doesn't affect you.
The drugs are using to treat a condition, right?
But you can't separate that out. You can't separate that out easily. Last year's name.
Treating a condition at all.
Why not?
It's not treating a condition. It's just treating like being a human. Like
there are lots of people.
The majority of people that are on birth control aren't on it just because they don't want to have kids.
Why are they on it?
Why? Because it regulates hormones. It's hormone therapy.
Yeah, a lot of people are on it for control of menstruation, for control of pain associated with menstruation. Like there's a lot of reasons why people use the drugs and other interventions that are typically termed birth control for not just preventing, for not just for contraception, but also for additional like I say, controlling menstruation or whatever. Also, I think you're overstating how reliably predictive one can be about the expense of birth control in any given month. Lots of women need to change the type of birth control they're on with some frequency, and some need to like stop or start it quite immediately as a result of changes in their medical condition. So while yes, it is generally an ongoing cost, it's not like a super static one.
5 more minutes on this topic. Real quick, 5 more minutes on this topic. After that, we'll move on to the next one.
I mean, I'd like to know how common it is to be using birth control. Like how common is that someone would take birth control even if they weren't having sex, just for the other effects of it.
Well, I don't have any statistics, but I know that everyone in my friend group was on birth control before we were having sex in high school, and that's, I know, entirely anecdotal. But I'm sure if we found some statistics, it would correlate, because let's say so you're saying that it should be, but only for women who need it for things like that, but it shouldn't be free for women who want it to not have a baby.
Well, yeah, I'm just saying those are separate issues.
Yeah, but it's the same drug.
A lot of doctors I know a lot of doctors will actually not put it under birth control and actually allow women to be covered under their insurance with that particular birth control if it helps balance out their chemical processing and stuff like that. I know doctors will allow that to be covered under their medical because it is a medical thing they need versus birth control. They'll actually go other way to find out and use that as, hey, this is the prescription they need, blah, blah, blah. And I know that does happen. So I mean,
well, I felt like we already established that pregnancy is kind of like a health issue. Even if it wasn't a health issue, it definitely does affect economics and overall society. So then still, like, no matter what is the ratio between people who are using birth control for whatever reason, we're still going to be reaping the overall benefits of lower infant mortalities, of lower unwanted pregnancies, of hormone therapy. All these things, they're all bundled together. Like, there's no we're going to take this and then dish out that, unless you're going to bring up some religious arguments.
Yeah, to be honest,
I
birth
just want to hear
control
like,
is
a very specific case for why the cost of birth control should be socialized, other than and a case that that couldn't be just applied to anything else, right? Like,
Well, I
well,
mean,
we've already.
really
that's
important.
kind of the point, that like maybe everything should be socialized. Like,
Well, if that's really what you want to rest your case on, then like I don't think you do, because most people don't think that everything should be socialized. And if you want to say birth control should be socialized because everything should be socialized, you're probably going to lose the argument with most people. So there's got to be something specific.
well, there's no reason
when it
that
comes
like
to medicine,
birth control should be like socialized more than other like just as important medications. Like, but birth control just ends up being a tax on women, and I feel like this is just.
But it's not a tax; it's a cost.
I think she meant tax, like, non-literally.
Yeah, obviously.
Well, but you're just.
I didn't mean
tax
a
as the
literal
cost,
tax.
right?
I meant like.
Then
Jesus
everything
Christ.
is a tax on people who buy it. Like,
Okay, so last username.
Yeah,
there
that's
is
exactly what I meant.
there is a particular, as we've shown with the studies we posted earlier, there's a particularly high return on investment with birth control that isn't the case for many other medical treatments. There are lots of medical treatments that benefit people individually, but don't have nearly as great a knock-on effect on society. And like we can see this through natural experiments of countries that
taking birth control versus not taking birth control, or is this comparing like the government paying for it versus people paying for it individually?
Well, both.
Like, is the study assuming, like, say, looking at how many more people would take birth control if the government
yeah, the specific study I looked at, I posted earlier, was looking at a comparison of a state where the government didn't fund it versus a state where the government does fund it, i.e. it's still available, but not, with reduced access because the government isn't paying for it. And it's pretty clear that just generally increasing access to it improves, as Senpai Chow was saying, all of these many different outcomes. Also, as CityCat was saying, it vastly increases individual quality of life. I think if we're going to socialize anything, like birth control, vaccines, these are the like handful of real top medical interventions that should just be freely available as possible. So yeah, I think there is a specific argument that's much stronger with birth control than, say, for, I don't know, cancer chemotherapy or cardiac surgery.
Okay, I mean, you could be right. Like, if that's true, then those are the kind of arguments that I would like to hear as a libertarian. Like, this will literally save the government money if they pay for this, and save the taxpayer money, because that's a pretty good argument.
We're going to jump to closing statement. If you want to answer to what has been said right now, you can do it during the closing statement. So, yeah, let's start with since you're back, sourcing support.
Yeah, sure. And I was listening for most of that. But one of the ways we control cost is through preventive action, right? And the data supports this. This is shown not only financially, but in overall health outcomes, that doing this actually saves money and helps society. And it's not just at the government level. You have smart employers like mine that will actually pay their employees a few $100s a year to get medical screenings, because they understand that getting ahead of these things prevents further costs in the future. It should be self-explanatory.
Right. Red, gray, blue.
Okay, there you go. I'm off to mute. So I think it kind of comes down to the notion that fundamentally, if the government is already going to provide healthcare, then I'm okay with them providing a comprehensive plan. because at the end of the day, it's like I'm not sure like where we draw the line in distinction here. Because if you're already going to provide this service, I think it should be a comprehensive service to some extent, at the very least, when it comes to these services. And I think there are a lot of positive benefits that come from it. I hear the arguments around like, you know, where do we draw the line in spending, specifically on this individual, but I think that, you know, at least there is some kind of consensus that we can at least move towards some level of birth control to at least promote a healthier, more successful, and more secure society. And then as we move forward and realize the effects of these things are you know, manifestedly good, that we can continue to add to those services as necessary, depending upon the need or the sentiment of the people. So I think there's a place for it. I have you know, no concerns with that from a government healthcare standpoint.
All right, Senpai Chow.
Yeah, great time for to call on me. So I think my opening statement is copy and paste that for the closing. I feel like that's pretty strong on its own merits. I'm going to use my closing statement to then respond to last username. I know he can't interject, so maybe next time. Is that I don't think health insurance should only be for emergency care. It sounds like that's kind of where you were coming from. So if I'm mistaken, then might be. The reason why is because, well, you're going to like this economic argument, is that preventative care is a lot more cheaper than emergency care. And so if it doesn't matter, no matter how many times you do that preventative care, it is most of the time always going to be cheaper than one-time emergency care. So like preventing somebody from becoming obese would be more cheaper than treating them when they are actually obese. And the same thing applies to pregnancy and birth control, is that preventing that unwanted pregnancy is going to cost is going to be a lot cheaper for society as well as for us. So it's a betterment for again society, for us, for the government, population, whatnot, for the world. Woohoo! Let's go peace.
All right, let's use a name.
Okay. So the purpose of insurance in general is to mitigate risk, right? It's to take a big expense that you have a small chance of having and turn it into a small expense that you're guaranteed to have. That's the purpose of insurance specifically. However, when we're talking about public health insurance, government health insurance, that sort of turns insurance into something else. It's partly mitigating risk, but it's also socializing the cost. And generally, when you want to include something in government insurance or in public healthcare, I would want to hear a justification for that particular thing being the cost of that thing being socialized. Now, I'm generally not in favor of the existence of government, and if there's a government, I'm not in favor of the government providing public health care. But if we accept that all has all those things, then at the very least, I would want to hear a clear principle for why particular things should be included in that. It can't just be a matter of emergencies, because there are medical things that aren't emergencies. It can't be just a matter of necessity, because there are things that are necessities that you need to live, like food and shelter, that the government doesn't pay for. So I just want to hear the principle, and it may very well be that if the principle is just that it's a good investment, which I think is generally not the case, but it may be the case for birth control. If the study post-normal is providing is true, then the government would literally save money by paying for this. If that's true, then I can't really argue against that. It would obviously be a good decision for the government to make. It would save their taxpayers money. Aside from that, though, but if that's not true, and we're talking about a moral case, like should the cost of birth control be socialized, I just want to hear how do you decide whether something should be the cost of something should be socialized? It can't just be it's really important to me, I really want it. It's got to be something else, because there's all sorts of other things that are really important, that are essential, that you really want, that we accept should not be paid for by society. So that's the argument that I would need to hear. And I'm not saying, I can't say what I think of that argument because I haven't heard it yet. That's all.
All right. Post normal.
Hello, yes, sorry. Excuse mouth sounds. Yeah, so I'd just kind of like to essentially reiterate that I have no fucking clue about the US insurance system. It all seems very Byzantine and weird. But I do know that the introduction of birth control is, I say, arguably the greatest medical development of the 20th century. It empowered hundreds of millions of women to go out into the workforce, to live more independent lives. To generally improve their quality of life. It's raised national GDPs across the world. It's decreased the risk of birth problems, of premature births, of abortions. It's done all kinds of wonderful things, and as I showed with the study earlier, the cost of it relative to the benefit both to the government and society in general is, or I didn't show society in general with that study, but if anybody wants further links, I've got them, indicates that if we are to socially subsidise anything whatsoever, and last username and I might have a disagreement about that, but if we are to do so, then birth control is an absolute no-brainer.
All right. Beyond the tags.
I think that, having them provide birth control to people in certain situations, I think that it's all kind of, I want to say situational, but in the same sense, I kind of believe it would be if you're in low income and you think it's a right that the government provides that. I mean, honestly, if you can't support a kid, bringing a kid into the world, you shouldn't be messing around stuff like that. I believe personally, and maybe that's selfish, but I don't know. I think that you need to plan ahead to make correct decisions. Now, if you're talking about like for medical reasons or anything like that, I think that's the individual basis. And I believe that, the government, if they're going to provide something, having a small baseline to allow a small type of availability, I'm not going to completely disagree with that and be like, no, absolutely, because of taxes. Okay. If it helps, like they were saying, you know, in all these good ways, with population control and doing this and doing that, and maybe it helps some women with their hormone. I'm an open book, and I'll go ahead and listen. But making it, I believe, something that is, a norm and providing all of these things, I just don't think I don't think it's something we can actually do, because, well, for a lot of different reasons. To, we have some people that they smoke, they have different lifestyles, they have different medical needs, and we can't exactly hit everybody for what exactly they need. But I believe my baseline is, you know, there's other sources out there. There's private medical. There's a lot of resources out there, and it's your job, I guess, to find a job that provides stuff like that. If you're looking for something in particular, I believe there's a lot of resources out there to find exactly what you need instead of asking everyone else to give it to you. Personally.
All right, Brent or Bucks?
Yeah, I think kind of the point that I was making earlier about the definition of birth control and the fact that it does include abortion is one of the reasons why people in the U.S. would be against it being provided under a larger government program, which is ultimately what I think it's kind of what the topic is really about, because private insurance, as we said multiple times, doesn't necessarily have to provide anything, right? So if it was a universal healthcare system, it would have to provide basic things, and the question is, should it be included? And it comes down to basically the disagreement on whether or not abortion or birth control is moral, right? And so in the U.S., that's ultimately why there's any debate at all. And I think what Beyond the Tags was just saying is it does kind of come down to another principle of what the City Cat was saying earlier, when like socialize everything. It's like that seems like a terrible idea to me and to many people. And under the universal healthcare, government healthcare kind of program, is sort of like an impulse of like, well, just socialize it, just provide everything to everyone that they need. Any need that anyone has, the government should meet, and that seems sort of like, well, I don't think that works. I think that's kind of self-destructive, and that's really what the contention is, I think, between the left and the right on this issue, but on like a lot of issues.
Sorry. All right, and last but not least, the city cat.
Yeah. So I think that the government should pay for birth control because we live in a society which depends on the collective whole being willing to work together to tend to the needs of the few. And the women in all countries who need birth control are not just a few. You're talking about tens of millions of women, all of whom collectively help fund plenty of programs, provisions, and social goods they themselves will never use or need. Everyone chips in to fund an array of policies that, and it's hoped and believed, will benefit society. And a birth control mandate guaranteeing that women with employer-based health insurance would have greater control over her reproductive health is a very, very good one. This isn't about a woman's sex life and whether or not she should be having sex. It's about her own medical and reproductive health. And it's a very childish and reductive way to look at it as a sex issue. Someone could easily complain about men having drugs for erectile dysfunction covered by their employer health insurance, seeing as all it does is facilitate them having sex. But nobody does that because when men are centered in the conversation, it is conveniently understood that healthcare relating to sex and reproduction isn't strange, taboo, or off limits. It's totally serious and deserving of attention and respect. And if men had wombs, there would be absolutely no discussion here whatsoever because it would already be covered in health insurance. Yeah, so that's it. That's about it for me. Yeah.
If men had wombs, there'd be drive-through abortions on every corner.
Sorry, I'm supposed to be impartial. All right, so let's move on to the next topic, which is, do you support the death penalty? This would be our last topic, and before jumping into it, I just want to say again, yeah, first of all, thank you so much to everyone who's here watching. I appreciate like the views, people participating in chat and everything. If you want to support me, go follow and sub to Dylan Burns TV. Also, the last EPDP podcast is out. Just saying. Subscribe to his YouTube channel. I heard his video editor is great. And yeah, let's move on to the next topic. Do you support the death penalty? Let's start by Senpai Chao.
Oh boy. Okay. I have a moral argument with this, but I feel like that's not going to bode really well with some people over here. So I'm just going to get out of the way. I think life is a human right and it cannot be taken away. It is something that we are born with. Even if we are to commit heinous as crimes as murder or whatnot, life is still life. Then going on to the other arguments, at least within the United States, it does not have a deterrence effect. We have seen murder rates between states who have the death penalty and states who don't, and they are very parallel. In fact, states that don't have it actually have lower murder rates. So that's very interesting. To economic arguments, having the death penalty is very expensive because there are legal operations, there's a whole bunch of other stuff, blah blah blah. It's actually cheaper to have somebody life in prison than than to give them the death penalty, which is really really interesting. Uh, Other things include, well, a lot of Supreme Court cases, especially nowadays, are finding out that there is really no good reason why we can put more load or to say that the death penalty does more than life in prison. Both, I think life in prison is very suitable for all crimes, no matter how heinous they are. Uh, Life in prison without parole, that is. Mm, There was another thing, but I'm leaving it off. But yeah, abolish the death penalty. It's bad.
All right. Last username. You're muted, I think. Is
Sorry
it me?
about that. In
Okay,
principle,
perfect.
I have nothing against punishing people with death. I think sometimes people deserve to die, just as they can deserve to be in jail or various other punishments, if the crime is heinous enough. In practice, I don't think there's any actual the way the death penalty is actually implemented in practice. It's probably a bad idea, because why? Because first of all, it doesn't save any money, as Senpai Chow pointed out. It costs just as much. It costs more to send someone to death than it does to life in prison. Life in prison is already a pretty bad, a pretty terrible thing to do to someone. And there is this effect of, sometimes people are executed and then later turn out to be innocent. This has happened a significant number of times. Now, it's not as if getting rid of the death penalty is going to eliminate the problem of punishing innocent people, because it's still pretty bad to put an innocent person in jail for a long time, but it will slightly, marginally improve that problem. And it doesn't. There's no real good reason to have the death penalty. Like putting someone in jail for life is cheaper. It's just as bad. It takes takes care of any sort of punitive or removing them from society. It has all the same effects. So I don't see any particular reason to have a death penalty. But I certainly, getting rid of the death penalty is only a tiny part of the amount of massive reforms I would do to the justice system, which I think is overwhelmingly cruel and ineffective. But yeah, when it comes to death penalty, no, I don't have a death penalty.
All right. Post normal.
Yeah, so I would back up much of what's been said so far. I think that in a liberal democracy that everyone here, I believe, lives in, the state probably shouldn't have the ability to kill people generally. Like, maybe we can make some exceptions for, really bad terrorists and whatnot who we can't feasibly capture. But if the state's able to capture someone, probably shouldn't just kill them outright. The death penalty is, of course, more expensive than just locking someone up in prison for a very long period of time. It removes any possibility of restorative or rehabilitative justice, which might not be possible for the majority of people currently on death row, but seems to be plausible for a minority at least. And of course, as has been mentioned, there's a whole bunch of instances where not only DNA evidence, but other emerging forms of evidence have exonerated people after they've been killed by the state. And we can probably expect advances in forensic technology to lead to more ways of determining the truth in judicial matters, and it seems like a good chance that we'll find more innocent people in the future. So yeah, death penalty bad. Don't do it.
All right. Brent Obox.
I know there's a lot of problems with the death penalty. I guess I'm not completely against it in principle, because it maybe I should be, but it's just on a very simple level. Like, if you kill people or if you murder many people, it seems like an equal penalty. Now it can have incredible, there could be a lot of injustice. There's numerous cases of people on death row who were exonerated, and so in that sense, maybe you could argue that the process is so flawed that it should never be a potential outcome. And I can see that. And life imprisonment is, that's kind of a form of torture in itself. Not well, kind of. It's supposed to be it's a penalty. So it could be a perhaps a just or equal punishment for what you were saying, for what Post Normal mentioned. The most serious, the most heinous crimes. I believe we could probably do without the death penalty. But I think it does speak to something in people that, you know, if like someone murdered, you know, like, well, people do. The Oklahoma City bombing, you know, where hundreds of people were killed. Was Timothy McVeigh, was he put to death? Maybe no. Yeah. Those kind of things, they seem to cry out for kind of like some retributive justice. But even then, I'm not sure if that's if it is the correct answer. But I wouldn't be for like all out banning the death penalty. Because I still feel like there might be some cases where it's actually maybe warranted.
All right. Sourcing support.
So, personally, I think that the death penalty and frankly punitive justice system at large shows how lazy we are as a society. People are capable of growth and change, and I think that it's the responsibility of society to assist people with that. Hiding people in prisons is not an effective way of addressing the behaviors that people have that cause them to do these things.
Okay. Sourcing support. Beyond the tags.
Yeah, I'm sourcing support said that, well, very close to what I was about to say is that, yeah, there's times where I'm just like, you know, just recently with the 5-year-old boy, I just say to shoot the other dude, you know, whatever, but that's just because I think what he did was so heinous. But the actual death penalty, I mean, we could talk about the money aspect and all that, but I don't think it starts with until someone commits a crime. I think that our whole prison system is absolute trash, and we're wasting so much money there. They're making so much money off the prison system, and a lot of people are repeat offenders where they end up, if they weren't murderers, they might become murderers because there's no rehabilitation. There's no, you know, right versus wrong in a lot of the society ways. And the fact that, you know, us being lazy and just, you know, zapping them or this and that, I think is very, you know, dumb. I think that, yeah, there might be cases, sure, but I think that making someone slowly and painfully suffer for the rest of their life is justice for me. Just knowing that they will never be happy and fully in pain is, hey, you know, that's on my kind of book. And, you know, I think that that would be justice. But, you know, I mean, I think that, so when it comes down to the whole money part, I mean, I think that if we fix our prison systems, I don't think we would have as much issues with it being a money issue, I guess you could say.
All right, and the city cat.
Yeah, death penalty cringe. I'm adamantly against it from a purely a moral standpoint. I mean, also all of the economic things that come after it. But I think the fact that it's like horrific, and I don't think anyone ever deserves to die. It's incredibly horrific and unpredictable, and I think that trumps everything. If you, I get it. Listen, I definitely get it. When you see like an old man on the TV who has gotten away with raping children his whole life because he works for the church, you're like, fuck that guy. I want him to die. But here's the thing, we can't just be killing people because they do bad things. I think that's bad. I don't think that's a good precedent to set. I'm against the lethal injection from a medical standpoint as well. There's I can go into the medical side of the lethal injection and all of the bad things that go on there, and how often it goes wrong and how little it goes right. But yeah, death penalty cringe, bro.
Did I forget anyone?
Me.
Oh, sorry.
It's all good. I was just going to say that I think that the death penalty is a remnant of a punitive criminal justice system where honestly we need to focus a huge amount of resources into looking at how we can create a more rehabilitative side of our system, because quite honestly we can see that it's very broken in the United States. And so I think practically speaking, you can say get rid of the death penalty. However, I think fundamentally we should probably address the broader issue and that it is a symptom of, which is like, let's punish bad people, right? And I think that fundamentally, if you don't address that problem, you're just addressing one microcosm of the broader issue. And I totally subscribe to like the comments we've heard so far about like, oh, there's innocent people that get killed economically. Just for context, right? In like the state of Pennsylvania, it's like 1.3 million to get someone to death row. It takes like 18 years on average, and the person who's going to get like a life sentence in prison is about $725,000. So obviously there's a cost differential there, and it's a material one. So if we're going to have a death penalty system, and I have no issue necessarily with someone being executed if they are obviously deserving of the crime, and it's something very heinous, right? That part doesn't bother me so much. But I do think that we should shift away from this mentality, because honestly, I don't think we're doing a service to the some 20 million or some I think it's 2 million people that are currently incarcerated in the United States. And so it's just like, that is an incredible amount of people. And I'm sure it's even more than that. I'm just pulling numbers out of my ass. But, you get the idea that fundamentally a huge segment of our society is not being served. And just to focus on the death penalty, honestly, is just a small symptom of a broken system as a whole.
Based.
All right. You can engage.
Yeah, I think are we kind of mostly in agreement here that the death penalty is pretty shit policy? So.
Yeah, no one was like pro death penalty, were they?
Now, how about this one? What about like really serious? Like you brought up the Oakland bomber. What about that kind of situation? That's like like do we like that's where I'm kind of on that line. Where like I think like the Oklahoma bomber would be, I think that if we were to execute the death penalty, I mean he would be an example. Personally,
like,
if we were.
Why? But that doesn't help anything. I don't feel like killing someone who does bad things, that doesn't do anything. Why? It's. I mean, yeah, look at all the economical things. It costs more money than it would if we just put him in prison for the rest of his life, and then he gets to suffer as well. But like, death, like you're not doing anything. That doesn't solve any problems. It's like solving death with more death is it's not, it doesn't do any good at all.
I mean, there are some instances of war where death is, killing people is the best option of a bunch of bad options. But yeah, in the case of the death penalty, like even with the most obscene killers, first of all, we can almost never be 100% certain it was the person who we're convicting, even with a confession. Some people confess to crimes they didn't commit, etc. And I've lost my train of thought. Maybe it'll come back sometime. Someone else say something.
False confessions are actually a lot more prevalent than people expect, especially with young people. And surprisingly, like saying, "Oh, it's the death penalty," doesn't deter people from false confessions. So, yeah, I think that that's kind of like a wishy-washy argument, because like then you can just argue like.
Oh, sorry. You cut out a second
there. Yeah.
We all thought we had a seizure. We didn't hear you.
Yeah.
You just cut out.
Yeah.
Well, can I ask you a question? Like, do you not think that the death penalty and the knowledge of the death penalty for people who might choose to commit murder is in any way like a deterrence?
There's no evidence of that.
No, it's not a deterrence at all, actually. There's been multiple studies that just prove that death penalty doesn't deter crime.
My understanding is that there's no strong, there's not very compelling evidence either way. Like, I'm not sure. Admittedly, I'm not a criminologist or anything, but I don't think we can absolutely conclude that there's no deterrence. But the fact that it has been looked into quite a lot and we don't see any compelling evidence that there is deterrence means we probably shouldn't use that as a argument in favor of it.
Now, what about the option of having it available by like a cheaper option like Firing Squad that allows that person to, I guess, opt out of having life in prison if they did, say, a heinous life where they get 300 years?
Okay, so now you're talking about assisted suicide, and that's completely different.
Most of the cost comes from logistical and legal operations, and not actually them administering.
Well, I'm saying besides the price, because the price can change if we've ever fixed our whole
But
system.
the price is mostly in the like appeals process and all of the like equipment that comes around with it, rather than specifically, electric chairs are cheaper than injection or whatever. Actually, injection is cheaper, but like those are moderately expensive. But in the grand scheme of things, it's all the legal proceedings that cost a lot of money.
Just to
Still,
be clear,
I'm
are we
going-
putting a price on human life? Are we
Yeah, the
saying that
government does
whether or
all the
not
time.
we should kill people as a means of controlling the issues that we have in our society is a cost issue?
I think that's at least part of it, because
That's what I feel it is. I mean, that's what I hear people say. It's always, cheaper to keep them alive. That's what I always hear in almost every argument.
Yeah, I mean,
because sourcing, it's so much easier to tell somebody that like this is going to save money, therefore it's better, because that's how most people think, rather than actually going into moral arguments about like, oh, humanity and human rights and etc. etc. etc.
Do most
Of
people
course,
think like that?
those are
I
those are really important, but most people don't think like that. They wouldn't be convinced.
that's, I guess, fine, but like, I don't know.
I don't think
Why
there
are
is
people
any
against the
cost.
death penalty? It sounds like everyone here is against the death penalty, not because of cost.
Oh,
I
I'm
think
against it. I'm against it
The-
kind of like morally, like kind of.
I think one can be
like,
against it for multiple reasons.
I think they should suffer and be in pain for as long as possible and just make 'em really just hate their life. But that's just me. I mean, but
I wouldn't take that position personally.
Do we
I
not think
No,
people are
that's
capable of
such
change?
dude.
I personally think if you
that's-
shoot up a family, you should suffer. But I mean, that's just me.
What's
Okay,
your opinion on
so-
I
torture
think
out of
the
interest? That was the bonus
attitude
topic, but
We
that
could
like
blend the extra topic. with
yeah.
this one.
No, wait.
I want
I
to
have
he-
some contention. I have some contention with the people who are saying that the death penalty should still be on the board for some certain people. Yes, for some people who are like committing really heinous crimes, absolutely. Like that is, I can't argue against that. But the thing is that the death penalty doesn't just affect those people. The other point that I really forgot to say during my opening statement is that the death penalty and the system and how we actually determine who gets a death penalty is incredibly broken and discriminatory.
Yeah.
Black people are a lot more likely to get the death penalty than white people for the same exact crime.
Yeah, I've got an ACLU link for this.
Yeah, like this is why like so many Supreme Courts throughout the United States, and this is state Supreme Court, I'm not talking about the federal court, are actually striking down the death penalty, because they're saying that yes, like even though there is this practice, like if it's being done discriminatory, then like it shouldn't be continued, even if it is for the most heinous of criminals. The thing is that it's not being given to the most heinous of criminals. It's being given inconsistently. Some people get life in prison. Some people get the death penalty for the same exact crime.
Yeah.
That's so stupid.
yeah.
And it's substantially
just
influenced by
wanted to-
race as well.
I just wanted to add something as well. That okay, so this is kind of like my personal philosophy around death. I feel like your death doesn't happen to you. It happens to the people who care about you and the people who love you. Once you're dead, you're not gonna miss you. You're not gonna miss your life. You're dead. You don't care anymore because you're dead. So I feel like using the death penalty to punish people who've done bad things doesn't add up, because you're not punishing them at all. They're dead. They don't care anymore because they're dead. All you're doing is punishing the families of these people. So
if nobody cares about them,
Yeah,
then
but
there's no problem killing them.
You're robbing them of the possibility of future
no.
positive experiences. I
I
think
care
that's a
about
harm to them.
Yeah. Yeah.
But now, what
so-
about like? But this is the thing too. Someone lost. I mean, and this is the only part where, like, this is why this is kind of like, yeah, we could talk morally and stuff like that, but it is kind of get really kind of weird when people who lost their kid, they want justice, an eye for an eye, which is the first justice system that we had, is eye for an eye. You kill someone, you get killed. And I think that's why we've had it. It's not so much that yeah, I mean, if you're able to take out 4 people, does your life really matter that much, considering you took 4? I mean, you do trickle down in some of those particular things. But I mean, personally, yeah, there are times where I think having them sit in a prison with no TVs and none of that stuff. I mean, some of them are, pretty decent. That, when, and I think we need to not even allow it to get to that point. I think that we need to do it into our system to rehabilitate these people so they're not like, so people can learn and how to
Wait,
fix themselves,
you're
but also
talking about
identify problems.
you're talking about making prisons as shitty as possible, but also rehabilitating them. And these things
No,
are
no, no, no. I'm talking about rehabilitating people who've been in jails for, like, say, marijuana or petty crimes. Rehabilitate them to make to have them see why crime or stuff is bad, versus just punishing them, and now they're in jail 6 times. And for instance, say gangs or whatever.
weren't you
felons.
advocating for retributive punishment a moment ago? Are we saying retributive only against death penalty cases and like?
What do you mean?
Well, you were saying you wanted to throw murderers and so forth in a hole where they don't get TV and they have a shitty time of it.
Well, prison shouldn't. You mean, I don't think you should have TV in prison and stuff, especially life sentence. I mean, for some of the stuff you did, you shouldn't be
Right.
sitting back eating popcorn and watching Oprah.
But for for rehabilitative justice to be effective, I'm again not a criminologist, but as I understand it, this is pretty uncontroversial within the field. You've got to have a decent standard of living, like keeping them in poor conditions actively works against
Yeah.
rehabilitating people.
The people who are in there for murder and for life, obviously in a different facility. But look at New Zealand; they actually have places where people can go and say they just robbery, right? Let's just take robbery as a base point, right? Robbery, and they, hey, you got caught, you stole, X amount. This is why it's bad. This is this and that. If you need money, this and that, and they kind of rehabilitate them so they're not back in prison in 3 months. And so they actually can learn from their ways versus I have to make a living and this is all I know, giving them tools so they can step away from that life that may lead up to murder or whatever. Now, mental, that's a whole nother subject, that I don't think, hopefully one day we'll figure it out. But, I think that rehabilitating people and, allowing people not to be scared to admit that they have, a problem or whatever may allow us to reduce numbers that will end up being into jail for life or for murder or, possibly get the death penalty.
Yeah, I mean, I think we have figured it out in terms of mental stuff. There are places in, Scandinavian countries, New Zealand, Netherlands. Oh, no, what's the other one? There was one. I watched a
Belgium?
documentary about it.
Well, the
No.
Netherlands isn't
The Michael
Scandinavian.
Moore one?
Sweden,
Norway.
Denmark, Norway, Finland.
Y'all are just listing countries.
These are all the Scandinavian
Um,
countries.
Yeah,
Latvia,
okay.
Lithuania.
It doesn't
It's not
really
really
matter which
Scandinavian.
one specifically. But there's where they have like actual rehabilitative justice systems, and they do have separate facilities, like we were just talking about. But with like murderers and things like that, they do really rehabilitate them too, and they go to therapy, and they are successfully integrated back into society. Norway is the one that I was thinking of, by the way. And they like it's not like something that we haven't figured out yet. Like we do know that rehabilitative justice it works. They had to shut down in 2018. They had to shut down 2 prisons in Sweden because they ran out of criminals because their like reoffending rate was so low.
Netherlands had to shut one down as well, I believe.
But now, are we talking about murder? Like I did a DUI and I'm in jail for 25 years because I hit a kid, or are we talking about I walked up to somebody and shot a 5-year-old boy for no reason? I mean,
Most
and
things are
both. Both. So something like in the second scenario that you just mentioned there, that would be like a severe mental case, and they would be going to therapy to figure out what triggered that kind of thing and how they can cope with that in the future, so that they can successfully reintegrate back into society without having the risk of reoffending. And ultimately, it does work pretty well.
I just linked the documentary that I think the City Cat is talking about. It's Michael Moore traveled to Norway, and
they have little cabins. Yeah,
they have Xboxes and PS4s and leisure time, because that's also a part of life.
Yeah, because
Yeah, I'm
yeah,
okay
a
with that
big
part,
part of rehabilitating criminals is making sure that they are mentally comfortable in their current living conditions. Because making them feel like shit and making them feel like, oh man, my life sucks, I'm in prison, is just going to give them more mental issues. And I don't think that's a good thing.
And inhibit
No,
their
I
ability to pick up new skills, which they'll need for going on in the outside world. Yeah, it's
Oh yes, that's
I
another
mean,
huge part of
do you
rehabilitative
think?
justice,
Well,
teaching
do you
people how to get new jobs when they get out.
Do you think there's anyone who could commit a crime that should not be released and could not be rehabilitated?
probably, but not many of them. Like I personally wouldn't
Wait,
go as far as like some prison abolitionists and like say we shouldn't lock up anyone, but yeah,
No,
there
I
are
feel
probably a
like
few.
it comes down to I think it all comes down to mental stability. And some people are like they have serious, they're like criminally insane, like serious personality disorders that prevent them from ever being able to integrate into society. Um, and I think that like those people are exceptions, but I think it depends less on the crime that they did and more on the mental state of the actual person who did
Yeah,
it.
which
For
should
an
probably be
individual.
judged by medical professionals.
Yeah, of
Yeah,
course. Of
and
course,
shouldn't
like
be a
psychiatry.
sentence up front based on the crime. It should be individually assessed, and it's the same. It's the approach. We shouldn't assume that someone is not capable of rehabilitation. We should assume they are and work to do everything we can. And if we fail and they end up spending their entire lives in an institution, at least we tried.
Yeah, I mean, and that's what I mean. Like, I mean, I'm all about rehabilitation, and I think that, like, say the Unabomber or whatever, he does something like that, and it's like he finds out, for his punishment, it's like in those particular cases, do we bother with rehabilitation, or do we just put them away? And I mean, and I think we're all in agreement that we'd rather try to rehabilitate or put it in a system than just zap them and move on. I think that we're all in agreement with that, at least. And but and I think, and like I said, I think we should start rehabilitation way much earlier before they're in jail for 50 plus years. But instead of this consequential America system that we're in, that just makes people repeat the offenses because they have no other real options because of money or just the society that they live in. So
Yeah, we've got some
Sorry if
kind of
I'm like
consensus.
running around your point. I just feel like if the system of the death penalty is discriminatory, and like there's no reason why like people are getting the death penalty than not for the same exact crime, then like that's something to be thrown out. It's broken. It's done for. There's like maybe like you could argue that like if that weren't the case, then maybe there's merit in like defending the death penalty for cases like the Unabomber. That's just not reality.
Also, it's probably worth noting that studying these people is the like most extreme criminals is of genuine interest to psychologists, criminologists,
yeah,
etc. And if we execute them, we can't study them.
I was gonna bring that up too, like Hannibal Lecter, how they allow people to interview him and stuff like that. Like
Yeah, kind of
actually
like that.
learning what makes this person who they are, and can you see that in the future and prevent it, which I think is a huge advance in figuring out a lot of reasons why people do things, which I think would be much beneficial to society.
And I have several medic friends who worked in like Broadmoor, one of the major psychiatric prisons in the UK, and yeah, this work is absolutely fascinating. Interviewing them and studying their responses, doing physiological studies on them. Obviously, consensually, we don't want to just turn these people into like lab rats, but most of them are perfectly up for engaging in conversations with psychologists and whatnot. And yeah, it produces fascinating, useful research that we wouldn't get if we just, hanged them.
I also find it weird that we put a number of years to a crime and say that once you've got your time, you're done. Like you have reformed, you're okay to integrate back into society. Like what sourcing support says makes a whole lot of sense that like if they're not ready to go back to society, then they're not ready. There, in the United States, I know we have such a high rate of people going back to prison. It's stupid, and it ought to be done by a case by case basis. When they're ready, they're ready.
If
I think that's kind of done with parole, like to some degree. You know, the like psychological condition and probability of reoffending is taken into account when considering whether to release people early. But yeah, I think it should probably be more more individually determined. I would broadly agree with you.
Now, my only flip side to all this isn't really my flip side. It's so this whole, we're all kind of in an agreement of this and that. But what about when you have to tell a family who just lost their 5-year-old boy because someone just walked up and just shot the person, shot their kid, and the judge looks at the victims and goes, "Well, we'll rehabilitate him and put him back into the public when he's ready." Like, I mean, where's the justice? I mean, to me, at the same flip side, I mean, let me know the date, time, and where, and I won't bring a gun. There doesn't feel like much justice in the same sense on the flip side.
Pardon?
I mean, I
Does,
think there's
does
a, I think
justice
there's
just mean punishment to you? Is that what you think justice is?
What
I
I'm
think
saying
there's
is how soft and fluffy it sounds. Now, I'm not saying it is, but I'm saying is because I believe in rehabilitation, but I feel like when having that time paid off, right? That crime that they committed is, you do the death penalty in some cases are a justified thing, life for a life, eye for an eye. That's, like I said, it's our original justice system we
Morally
had,
corrupt.
but it's
The
still just the
reason that
So
it's
first
not our
system that we
justice
had.
system anymore.
But it's still this first system that we had as an eye for an eye. But
yeah, and we've updated
is
because it might feel good in the moment to get
no,
retribution
absolutely,
against
yeah.
someone who's wronged you or wronged your family or whatnot. But like most societies generally agree that that's not the best basis, and I think it's to some degree we still do engage in
That saying is like
Yeah, like the
retributive
Schadenfreude,
justice.
their
Yeah.
kid
the
and say
Schadenfreude that you
they get
get from killing someone that's done wrong isn't worth taking their life. I think that's incredibly
I think it is
selfish.
Might
worth
be.
considering restitutive justice, i.e.,
well,
like
that's
having the victims or victims' families made whole in some limited fashion. It's not unreasonable to expect that the offender somehow pays off the victim in some small way,
yeah.
but the purpose of that should probably be to improve the life of the victim as opposed to just making things shit for the offender.
Because we talk about, say, a mental thing, and okay, well, if he's mentally disturbed, we can't release him back in the public. Well, what about me? Well, I just go over there and shoot him. I'm fully mentally aware of my actions, and I'm like, well, rehabilitate me. I'm gonna go into a place. Now, I'm all about rehabilitation, remind you, but I'm saying is for those situations that people may just blow it off and be like, whatever, I'll just be released in 25 years because I don't have any mental issues. I just did it because I wanted to, and I'll be released again. What do we do with those people that
But
just want
Make
to?
them not want.
doing it because you want to, wanting to kill people and then acting on that action, that is mentally unstable. You can't be mentally stable and be like, I just wanted to kill that person, so I did it. Like,
Yeah,
that's not a
sociopathic.
thing. So
I'm
yeah, you would need to take probably ethics classes or something like that. Um, some kind of therapy in learning, I guess, right from wrong. But someone who just goes, I want to kill that person, I don't care.
I mean, I signed
They
up for the Marine Corps that way.
definitely have some
People
mental problems.
I mean, I
understand
signed
right
up.
from wrong. Like I felt like, I mean, beyond's question is fair though. It's like, I mean, part of like why the justice system functions is to prevent people from taking revenge on each other, right? And so if someone, does something heinous to someone's family member, and you say, well, we're going to rehabilitate that guy, we'll get him an Xbox, like, and he'll be there for 20 years till we think he's okay. And it's like, well, a father might just go and just kill that guy, and then just be like, okay, well then fine, rehabilitate me. It doesn't
And
sound that bad. And I got
Yeah.
to kill the guy who killed my family, right? Like, people, you have to prevent people from like doing this.
Right, and that's why we
And
make killing people illegal. So if the father goes and kills the murderer, then yeah, that's illegal, and we put them through the justice system. So
sure.
Yeah,
Well, and the
seeing
other
that
thing is
revenge
that
in like other countries isn't a norm. So then, for countries that actually have rehabilitative justice prisons, uh, those victims, like the victims of the families, those families, they're not like wanting to hate the person who committed the murderer. They're also a-okay with the restorative justice. So then, like, when it comes to like things like revenge, stuff that's like coming out from Shakespeare, I think that's a cultural issue rather than something that is inherently human. Um,
You don't think
some top
revenge is
story.
inherently human?
I don't think so. I think it's
I think it's
constructivist.
pretty fundamental.
I think it's constructed, but that's just my ideology.
What do you mean?
Well,
I'm a social constructivist, is what I mean.
well, constructive doesn't mean not fundamentally
feeling,
human.
Well,
True.
feelings of Schadenfreude, which is getting pleasure out of someone else's pain because they've like not just because of wronged you, but if they've miswronged you, that falls into Schadenfreude. That's neurological and it is part of the human condition. But I think as being developed peoples in like a proper society, that we need to be able to recognize that that's not constructive, and not act on that.
There's lots of things that we have urges.
That
Sorry.
wanting to kill someone because they've harmed you isn't constructive. That's not. Do you know what I mean?
It constructs good feelings in our brains.
Right, but
yeah, but it also
rational
constructs
desire for
you being in prison, and it also constructs you throwing your entire life away because you just killed someone.
Real quick,
So
like you guys are.
we don't have to throw people's lives away.
Yeah.
Wait,
It's not the killing that does that. It's the punishment.
hold up. There's two people who want to hop in, sourcing support and beyond the tags.
No, go ahead.
Okay.
Well, I was gonna say, I mean, when I joined the Marine Corps, I mean, was to go over there and defend my country and shoot the people who are destroying, America. That was pretty much what I mean. Of course, I was young, dumb, and ready to go. Of course, I had weird ass childhood, but I mean, I'm not mentally disturbed. But I mean, but also, and I'm talking about, the right, yeah, you accidentally hit someone with your car and kill their kid, and or this and that, a stray bullet hit someone, or this and that, or this and that. Like, I understand that not everyone means to do what they mean to do, but my question is probably a horrible one, but I mean, not everybody deserves a rehabilitation as well. I believe some of those should just find a place. I mean, I'm just saying. I mean, do you think you can? Hey, Hitler, can we rehabilitate you?
But
Someone
if
that
we,
has that mentality.
well, first of all, we don't
mentality.
base the entire justice system on edge cases, and if we're talking about someone like Hitler, it's probably again much more valuable to keep them alive in order to
Yeah, no, I agree with that. I agree 100%. I'm not saying kill them. I'm saying is that there are some people that are just willing to do it, and I don't think that we should be like, oh, let's rehabilitate them. I think that would be the time where at a certain line where it's, oh, they're not being rehabilitated. They're done.
There probably are some people who can't be rehabilitated, sure, but I think most of us on the side of, I say most of us on the side, we're all kind of on the side of rehabilitation here, but I think most people here would say that there are some people who can't be rehabilitated, but we should default to rehabilitation and only keep locked up the people who, based on psychiatrists or criminologists' recommendations, who are unlikely to be able to function in society again.
I got a edge case response to Beyond the Tags. Are people aware of not aware? Do people know about the Rwanda genocide?
A little bit, unfortunately.
Yeah. Okay. So the aftermath to the Rwanda genocide was a huge rehabilitative justice experiment, where a lot of people who were committing the crimes or committing to the slaughter, machetes going from house to house to their neighbors, chopping up other people's families. They were being sent off to camps, and in these camps, they're being rehabilitated basically to hopefully reintegrate back into society. And there's this one sob story which gives me like the most optimism, because there's this one woman who witnessed right in front of her eyes the slaughter of her entire family by machete from her neighbor. And the story goes is that she went to one of these camps, she confronted the killer, and like the killer was incredibly guilty, apologized, and unloaded everything that he said, and there was forgiveness. Crazy, right?
Yeah, I mean, I know that people can forgive, but then that's the only point I was bringing up. I think the only flip side to that is if people aren't feeling that the crime they committed was actually being served as a consequence, or being to not like they actually don't feel like their time or their punishment was severe enough for the crime. Like, did the time they serve or what they doing is actually going to match up to what actually happened? And that's why I think the line would come into of having just a baseline of rehabilitation or this and that. I think it would be, what I'm saying is, case by case and certain points, and I think that would be obviously look into what that person actually needs, not just, hey, here's the system, throw them in it.
Like, so long as that system is not discriminatory, then I mean, maybe for the most heinous of criminals, the thing is that we have a really hard time distinguishing or like giving out the death penalty to the most heinous of criminals, and most of the time it's being given unfairly.
Real quick, we're almost at the 3 hour and a half mark, which is usually the end of the
Well, that went quite fast.
of the podcast. So I think we're going to. Yeah, I'm going to leave like 5 minutes. After that, we're going to do closing statement and shout out. Yes, sir.
So what are we doing now? Just
There's
like continuing.
unless,
No, that's
I
good.
know
We can-
you. If there's someone that wants to add something, now is the time. Otherwise, we can do like closing statement.
Well,
and, yeah,
on
shout
the
out.
bonus topic, I'd like to say, despite Jack Bauer from 24 being very cool, I think we probably shouldn't torture people.
Are we switching topics?
I'm just
Uh,
contributing
no,
to the
We
bonus.
cannot get into a new topic. We do
Yeah,
not have
no,
enough time
3 hour
for a
and
new
a
topic.
half.
Fair
yeah,
enough. Fair enough.
I think we have
Um,
100% certainty that this person has information and can save a lot of lives. I say I'll bring the jumper cables.
I probably shouldn't have brought that.
We
I probably
cannot
shouldn't have.
get into
No,
this
no.
topic.
Yeah, it's kind of a deep topic.
But I think we broadly agree, at least, though, that death penalty, at least the vast majority of the time, is very sucky, and that rehabilitation is best. And I think it's nice that we've managed to find something approaching consensus on this panel of people with very different political beliefs. So, yay us.
Yeah, hey, we got 1 out of 3.
Yeah,
We're all
that's not bad.
centrists here.
Yeah, red, grey, blue. You've just sucked us into your centrist vortex.
I said very little in this last one. I think it was all you guys.
all right. So should we hop in closing statement and shout out? All right.
Sounds good.
Let's start by sourcing support.
So I wasn't planning on bringing this up, so I can't remember the data, and so I'm going to phrase it a little bit more generically. But there is some research around early childhood development and how that sets people up for how they will behave in society. And so I think maybe we should consider whether or not our culture of punishment is something we want to perpetuate in every generation. And I'll leave it at that.
All right. Red, gray, blue.
Honestly, I thought in this topic there was a lot of really great points made around rehabilitation. I think that's something that we should push for, honestly, in society. Like, I definitely understand like the desire, or maybe it's the gut instinct that I would say that I would want something like a more definitive punishment. But I think that's just my base self saying, oh wow, you're a pedophile, therefore we should kill you, right? I mean, I think it's a guttural instinct that arises from something that happens like that. And I think it's very challenging for society to accept the notion that we would say, let's push to rehab this person, let's push to have this person come back into society, even though they've committed some heinous crime, whatever it may be. So I fully understand the instinctive desire to have something in place, but I do want to push for the notion that we as a society can continue to be better, and continue to push for a more positive outcome for people that could entail rehabilitation. And obviously, I don't expect it to cover all branches of every single crime, but earlier we were talking about incrementalism, right? I think you could start with something like, let's try focusing first on rehab for people that are not in life imprisonment, for example, right? But I definitely take the point that the rest of the folks bring up about trying to change the society for good and doing so. So I'm there.
Yeah. Also, don't forget to shout yourself out. So sourcing support. Sourcing support. He does programming. He talks about politics. He usually streams in the morning, I think. Not sure with the time. But yeah. So yeah, definitely go check him out. Red Grey Brew. Shout yourself out.
So generally I stream politics, occasionally the random topic of just chatting. So we cover a variety of things from sometimes AI, sometimes I guess effective altruism. Postnormal was talking about that earlier with me on the Discord and etc. But in general, I think there's a lot of interesting things that could benefit from positive discourse, wherever you stand on an issue, and that's pretty much what we try to do. And so right now we're building out content for a variety of things. So if you're interested in coming on, having a conversation with us, please come over. We'd love to have you there, and see you soon.
Yeah. Postnormal.
Yeah, I might take you up on that, Red Grey Blue. This has been a really pleasant conversation. And yes, I believe you were shouting out specifically Will McCaskill's book, Doing Good Better, which I can confirm is absolutely excellent, highly recommended. Also, to promote myself, I'm Postnormal. I'm a Oxford grad student working on niche issues in neurosurgery, but I'm also interested in effective altruism and bioethics and the future. I often talk about these topics or about politics. I'm kind of, as you've seen so far, broadly liberal. And I often have good guests on. So I had Professor David Dunning of the Dunning-Kruger effect on a couple of months back. I have Anders Sandberg, who is a fascinating futurist at Oxford's Future of Humanity Institute, on every so often. And yeah, come out and chill. Yeah. Oh, a subscribe, follow. Excellent, lovely. Thank you for City Cat. And so that's me. Yeah.
Let's use a name.
Right. So I think the purpose of a justice system, from the perspective of people who live in a society, is to help them resolve their disputes with each other and to protect their rights against malicious other people, and to seek compensation from the people who wrong them. I don't think the purpose of a justice system should be to sort of engineer society or to rehabilitate people. I'm skeptical that the justice system can do any rehabilitation beyond mitigating its own negative effects that it causes itself. But yeah, so it's difficult for me to participate in a discussion like this. It's a lot like how many angels can dance on the head of a pin. It's like I have to make change a lot of my beliefs implicitly in order to even participate in the discussion. If you want to find out the kind of justice system that I envision and why I think it would be a huge improvement over the nasty justice system that we have now in most countries, in the U.S. and most others, even developed countries like Canada. Come to my channel, last_username. We talk about that and a whole lot of other things related to liberty. And it's good talk today, guys. Good talking to you. Hope to do it again sometime.
Hell yeah. The City Cat.
Hi. Yes, I'm a very lazy streamer. I have not streamed in the past week, I think, because I love panels like this. And I feel this is so much fun. I really love talking politics. when I do stream, I stream games or I stream politics. I do in the future want to host my own panels. I have co-hosted some panels. I'm a BDSM education advocate. I talk a lot of I'm based. I'm very based. So if you like based people, follow me. I think that death penalty is bad in every single case. I cannot imagine a case where the death penalty would be good. Um, I'm going to be co-hosting a panel on Prime K's channel, Prime Kai's channel. I don't know how to pronounce it, on Prime's channel. And it's going to be an all-women's panel called the Amazon Lily Roundtable, and it's going to be very, very good. We've got some good topics coming up there, and that is going to be on Tuesday night. So keep your eye out for that.
Awesome. Also, real quick shout out to Prime Kai. He hosts open panel that are really great. So yeah. Beyond the tags.
I mean, my whole thing is that, whether you disagree, I always say that, if you always butt heads with someone, it's never going to be good for our country or whatever country you're from. If we're always arguing back and forth, I think that even if it's against your principle, I think finding a middle ground for most things, or at least a compromise, in some way, same form, sometimes some things are, not to be infringed on, but I think that if we can find some room to help some people who are less fortunate or whatever, is a really good thing to better everyone. But I just think having discussions is honestly the only way we can do that. But a little bit about myself. I mean, like I said, I do a nonprofit for vets. On my channel, I do politics here and there, but gun politics, stuff like that. Planning on actually tomorrow, I'm going to a protest to get rid of child support because I believe, anyway, and do some gun streams. I've done interviews with George Jorgensen and Spike Cohan and stuff like that. So I do all kind of just variety and just kind of what's going on. But soon my channel is going to be very little politics in a sense, besides guns and stuff like that, but mostly for vets and hearing their story, taking them out to lunch, and just letting the stream hear their story and talk to them directly, and just kind of just spreading the word because, regardless on you're on the left or the right or wherever you stand, I think that, the people who give their life for these countries and are affected by today's society and the decisions, I think that we should honor them and give them everything we can, and help them out the best we can. So,
can I just say thanks to everyone for being pleasant and like reality based and polite. I think everyone was, despite some disagreement, very nice in this panel, and I've enjoyed it very much.
Just to be very clear, I don't agree with anything you say post normal.
You bastard.
That was so cool. Like, I did little to no work in terms of moderation. I didn't mute anyone. It was
sometimes
really
a light touch is what you need. Well done.
Yeah. Also, speaking of moderation, I need to thank my wonderful co-host Danabo, who helped me a lot in the background. So yeah, shout out to him.
Hi.
And we did Beyond the Tags. Senpai Chow.
Life is life is life. Life is a human right. Something that I can't take away, something you can't take away, the government can't take away. It's all inherent in us. And if that's the case, fuck the death penalty. I'm Senpai Chow. I stream politics in MapleStory. I just recently graduated with a political science and international relations degree. I talk everything politics, politicking, political science, and political philosophy / theory. And that's me. Thank you very much for giving me this opportunity, and it was a wonderful chat with all of y'all.
Awesome. Brent O'Bucks.
Yeah, there's a lot of problems with death penalty, especially with a system that isn't inherently just, even if we call it like the justice system. So I think that's a good argument if you want to say you get rid of the death penalty. But I do think that people recognize, and an eye for an eye, even though that you can say that's barbaric. That if someone takes someone's life, then why shouldn't they forfeit their own? Or why aren't they therefore forfeiting their own? Or what could possibly pay for life except the life? I think that's kind of like the basic understanding that people have, and that's kind of what the death penalty is supposed to address and like fulfill for people, even though you might say like it's not enlightened, right? So I think you could certainly have a functioning society and justice system without the death penalty, but I do think that people call out for some kind of punishment when they're harmed, or when the innocent are harmed, or when their families are harmed, and I don't know if a system that was focused purely on restorative, or no, not restorative, but rehabilitative, would be entirely functional. I think people would feel maybe like they weren't getting justice at a certain point. But yeah, I don't know if the death penalty is absolutely necessary. So yeah, that would be my final take on it.
All right. Did I forget someone? Apparently not. Awesome. Yeah, thank you so much to everyone who was here. Yeah, I had a blast making this panel. Yeah, I hope to see you soon on the Hippy Dippy podcast. And I'm looking currently to who I'm going to raid.
What time's that Hippy Dippy podcast again?
Yeah, the Hippy Dippy podcast is every Friday, 8 p.m. EST.
Yeah, I've enjoyed some of the previous ones. It's been very good.
Yeah.
Well, how are you like surviving this, man? If you're in Oxford, then you must be dying with me.
Oh no, I only woke up a few hours ago. My sleep schedule is completely fucked.
Oh,
my sleep schedule just went from night shift to, hey, you're gonna open now. Oh, yay.
Oof.
Switch up parkour.
Just grab some modafinil and hope for the best.
Well, because everyone's they're not really applying for jobs because, well, unemployment is ridiculously high, and everyone's like, well, I don't really need a job, so we're not really getting people signing up like we normally do. So
yeah.
Right. Well, yeah. Thank you very much. This has been an absolute pleasure.
Yeah.
Great talking to you guys.
And hope to see you all again in the future.
Hell yeah.
Yeah.
See you around.
See ya.
You guys have a good one.
All right. Well, this was fun.
Yeah. Thanks for the invite, man.
Yeah. Very cool.
Anytime.
Fuck you, Brento.
Yeah. Fuck you all too.
All right. Fuck the lot of you. Love you.
Yeah. See you guys.
Yes. Fuck all of you guys.
Right. Okay, I am still streaming on mine. Yeah, that was genuinely a lot of fun. I haven't done political debate like that for a while, but yeah, hopefully I'll do some more in the future. Thank you very much for everyone in chat who's been contributing and being super cool, and thanks Amy for staying up. It is I didn't expect you to, but it's nice having you along. And yeah, welcome to new followers. And I stream at like 8 p.m. Mondays, Wednesdays, Fridays, 8 p.m. UK time, which is 3 p.m. US East Coast. And yeah, so that's bye from me and bye from my cat. Oh, give a meow, give a little meow. Come on, there we go. Okay, ta-ta everyone. Yeah, got to keep it civil. All right, see you later. I will be along later this evening probably, or at least I'll try.